Or if you want me, Bob will switch.
Yeah, I can do that too. Want to do that? You want to do
I showed earlier next time. We are doing it.
We should.
Whenever you're ready.
I'm set.
Yep, you should be good.
Okay. Good evening. I'd like to call this March 2026 Operations Work Group to order. There are no public speakers for tonight. And I am not seeing any written statements. Yep, I'm not seeing any written statements. Okay, so on to the okay. So on to the proposed minutes. I will approve the minutes from the Operations Work Group meeting dated February 9th, 2026.
Second.
And our representative here with us.
Yes, I'm here.
Board member Lee, your advisory vote.
Aye.
All those in favor?
Aye.
Aye.
All right, motion carries. So we have a full agenda tonight. Going to continue with our budget development. With that, I'd like to pursue Dr. Gothard.
Thank you, Chair Castro, members of the board, staff and community. Thank you for coming together on this beautiful Monday afternoon. And we've got a lot to talk about tonight. First, we're going to have a overview of our health insurance, our benefits from our staff here to talk with you. And some of this information you've had before, we're presenting it now so that we can get some direction for us to go. Well, I talked to colleagues all over state and some of my colleagues around the country. This is not something that is just impacting school district. You know, the cost of health insurance across the country is rising. And it's obviously troublesome for us. We looked at our benefits. One reason why people want to work here and stay here is we take care of our employees and their families. So it's really important that we get this. But we also do it in a way where we understand the decisions that we make. And what that's going to mean for our overall picture is to budget, to how we're going to. So I'll turn it over to Rachel to give tonight's update. Just want to thank Rachel, Jennifer, for your work. Thank you.
I'm gonna just ground us in our strategic framework and our guiding principles and our guiding commitments, and then introduce Rachel, Carabelle, and Bree Hellenbrand from M3. Rachel is our benefits manager, and M3 are our consultant that we work with on our insurance. So. Go ahead.
Sure. Good evening. If Desi, could we move forward a couple of slides? Yes, that one, yeah, and then one more. Okay. So we wanted to start with just a little bit of data about the current state of our health plan. This slide shows a little bit about who uses our health plan, where they're enrolled. You can see about 27% of our enrollees are enrolled in our Dean Health Plan. About 73% are enrolled in Quartz. About a little over a third are enrolled on a single or individual plan, and about 2/3 are enrolled in a family plan. Total, about 3,700 of our employees are enrolled in health insurance. And then the pie chart on the right, you can see vast majority, 60% represent teachers, educational assistants, and so on. Next slide, please. This slide shows a little bit of the history of our health insurance renewals over the last few years. We have received several years in a row with double-digit percentage increases in our insurance. The board district has not made any plan changes over that time frame. Next slide, please. So this slide, I know we've shared this before, but it always is worth going over what it means. The chart on the right, protractor there, shows what MMSD claims are over the premiums that we pay to our healthcare. You can see their quartz is a little over 100%. So that means that our claims are about 105% of the premiums that we pay. That number is better than it's been for a couple of years. And a lot of that is because we've had such significant rate increases the last couple of years. Dean is still at about 120%. So again, 120% of our premiums are being paid out in claims. That is also an improvement since the last couple of years. The goal that the health plans have for that number, 90%. That means they prefer claims to be only 90% of the premium. Next slide, please. This shows what we're estimating right now. Based on the initial feedback we've gotten from the health plans, we're estimating about $98 million will be paid in 26-27 for the health insurance plan based on the benefit designs that we have now and the rates that the health carriers have given to us for them. We're estimating that's going to be between 14 and 16 million of an increase over what's currently in the base, which is, it's about a 17.3% increase is what we're estimating overall between the two carriers. And then you can see a little bit there what our current plan design is. Again, that hasn't changed for several years. Next slide, please. What we wanted to share with you were a couple of different options that the board could adopt if it wanted to change the plan in order to reduce that increase. We limited it to these three. These are, initial estimates. If you have any feedback or want others, please share that feedback, but we'll walk through each of these on their own. Next slide. So the first option here would be to increase the employee share of the premium. So right now, as you'll recall, employees pay a percentage of the premium each year, but it's tiered, meaning our lowest income employees pay the least and our highest paid employees pay the most. Under this option, we are suggesting you could increase that premium share for everybody by 2 percentage point. And if you did that, we're estimating that the district could save $2.1 million off of that increased level. This would maintain that tiered approach. It would be taken in employees' paychecks. One of the nice things with changing the premium is when it's a payroll deduction, those changes in deductions are pre-tax. So that tax saving could partially offset the increase that employees would see in the premium. Also, and we have a slide here that shows this, but it's more typical for school districts to have the premium share be somewhere between 10 and 12% of the premium in Dane County. Ours is much lower than that. We're currently on average 6%, and it ranges from 2.5% up to 12% right now. So we are out of line with a lot of other Dane County districts. But again, we've got that tiered approach. And so on average, it's 6%. Next slide. So this is the table that shows what the current percentages are for our HMO plan. HMO stands for Health Maintenance Organization. That is the lowest cost option employees have. That's one where for the most part your benefit applies if you go in network. If you go out of network, there is no benefit to employees unless more than zero. But you can see on the right, if everybody's premium employee group went up by 2%, you could see what the percentages are. But this is option 2. We have an A and B, different flavors, just to see what the range of savings might be. The plan deductible, that's that amount under the health plan that employees pay first before the plan starts paying benefits. Currently, our plan deductibles are $100 if you're an individual or $200 if you're a family. So under the A option there, if we increased the deductible $250 for an individual or $500 for a family plan, we estimate the district could save about $774,000. Now, it's important to know this estimate is assuming only 6 months of savings in the first year, because we would recommend that change not go into effect until January. Our deductible year is January to December, and so you'd want to align that change with open enrollment. You would like to most likely avoid doing deductible change mid-year, so that's why we only recommend 6 months of implementation in the first year. Just to give you a sense of the dollars, we suggested a B alternative, which would involve increased deductible to $500 an individual plan and $1,000 for a family plan. And the savings increases to 2.1 million. Again, that's only 6 months. Next slide. Couple of things to think about when we're talking about increasing the plan deductible. One way that employees could help offset that increase in out-of-pocket costs is by putting more money into the flex savings account, the FSA. So you can put money into those accounts, goes in pre-tax, and then you could be reimbursed for any of those out-of-pocket costs that you incurred. And again, as I mentioned, the savings would double in the second year. Next slide, please. The third option that we're presenting is the idea of offering a choice. So we would continue to offer the same plan we currently offer, but we could also offer employees a choice of a high deductible plan with an HSA or a health saving account. Again, because this involves deductible and some plan changes, we would want to make sure we aligned it with open enrollment and the fact that we would want to avoid mid-year disruption for the deductible. One of the things to think about, because this is a choice for employees, there has to be a sufficient incentive for employees to join a deductible health plan, and that can be an incentive can be in the form of the lower premium. It can also come in the form of the district making contributions to someone's health. And a health savings account, a slide that goes, but that's the individual account for that employee, where the funds can accumulate and then they can be reimbursed for their healthcare costs, including their deductible or other kinds of out-of-pocket. Another component of this to keep in mind is employee education is going to be critical. A high deductible health plan operates differently than a more traditional plan. And to make sure people understand what their new offerings are, we want to make sure that we're doing a really good job with getting information out to employees. Next slide, please. So this is just a little bit about a high deductible health plan. A high deductible health plan is defined in federal law. So these are their rules, they're not ours. The IRS actually sets the minimum deductible. So in 2026, the deductible has to be at least $1,700 for individual plan and at least $3,400 for family plan. Again, the federal government defines that everything covered under the plan has to count towards the deductible except for preventive care. So your annual physicals, your vaccines, your cancer screenings, certain drugs do not count towards the deductible, but everything else does. And that is one issue that I think is really different and is an important piece of that education, is making sure people understand that pharmacy costs also towards the deductible unless they're a preventive drug like certain chronic disease, like high blood pressure. One other thing to think about is that, again, federal law says if you have HSA, the only health coverage you can have is a high deductible plan, not tie it to another deductible. You cannot have a flex spending account. You can't have any other coverage other than a health. Otherwise, there are tax consequences for the person who holds a savings account. So again, these are all things we'd have to make sure that we're communicating to employees so they can those choices. Next slide, please. And then here's a little bit about a health savings account. So contributions to a health savings account are tax-free. We can contribute, the district can contribute, but employees can also contribute. They can be reimbursed, or they can reimburse a variety of medical costs, not just co-pays and deductibles. You can use it to purchase glasses, you can use it to get dental care, things like that. So a variety of different types of out-of-pocket expenses. One thing that's very unique about the health savings account is if you don't use all that money in your account, those unused funds will roll over from year to year, so you can actually build up a balance in those accounts. Also, the employee owns the account. It's theirs. We contribute to it. If they don't use it, they put the money and they can take it with them if they leave the district. Also, you cannot, once you're on Medicare, you can't contribute to a health savings account, but you can use any funds within that to pay for your Medicare Part A, B, C, and D premiums. So, that's another important education piece, especially if we've got pre-Medicare retirees. Next slide. So we're estimating that if the board were interested in adopting this as a choice for employees, if you went with the minimum deductible allowed, $26, the district would save about $700,000. Now that's relatively low, partly because we're assuming that the enrollment would be low initially, but also because we would implement it in the first or in January, so it's only a half-month savings. We do expect that savings and participation would increase over time as more people get comfortable with these kinds of plans. And this is what other employers see. When they initially roll out, it takes a while before employees engage. The other thing is there would be a very small administrative fee to actually administer the health savings account. And that would be important for us to manage those accounts if the employee is going to make for that health savings. Next slide. So this is a summary of the 26-27 fiscal estimate from all those options that are prepared. Again, if we change the employee share of the premium, we're estimating that would save the district about 2.1 million. Options 2A and B, those are the increasing the deductible options under our current plan. Again, those are only 6 months worth of savings, not a full year, so it's about half. And then option 3 is that initial estimate if the board were to offer this as an option. Again, that's only a half of a year worth of savings. Next slide. So that's all we have for health insurance.
Okay. Board member questions? Board member Moses Falcon.
Thank you. Thank you for the presentation. I want to make sure that we're all contextualizing this. This is not an MMSD problem alone. And it's tied to just how we approach taking care of each other as a society. So making sure that we're, Bri, I have one question for you and then a question for the team. But actually, I forgot to say thank you. So thank you for this presentation and thank you for keeping us up to date as you've been engaged in the negotiations. I appreciate it a lot. Bri, can you talk to me about the high deductible option and like in your career and with your perspective, how long has that been something that organizations are looking to? Can you talk to me just a little bit more about like where this comes from?
Sure. Yep. It has, I'm trying to remember what year it came out, and it was under the George W. Bush administration, right? That's when it was first created. And I'm really bad with dates, so I forget.
That's helpful.
But it's definitely been around for a very long time. And when they first created it, it was really designed as a retirement vehicle, right? It was to encourage people to be able to put some of those dollars away. So let's choose a plan that isn't taking as much out of our paycheck. And then we can, when we're in hopefully good shape, right? If we're not experiencing a lot of medical issues, try to put that money away. It was encouragement to try to have, people start this when they were younger and really accumulate a lot of funds, because when you're heading into retirement, then when you're no longer working, and let's face it, when, we get to a certain age, that's when we have some medical challenges. You have those dollars when you're no longer working available to you, so that you use that tax-free, vehicle to store those dollars. That's why it was created. I will say that it took a while to take off in the schools, right? So, I speak in post-Act 10 because that's when things really changed in the insurance world for schools. What came onto the horizon first were HRAs, health reimbursement arrangements. They were very popular. They were typically attached to a higher deductible plan, but they still had co-pays, right? Co-pays like we're used to right now on our traditional plan. I still have a number of schools that are on a high deductible with an HRA, so they still exist. But then it became a real interesting option because a lot of, clients in the private sector had, these high deductible plans with an HSA. It's like, hey, I have this bank account, I have these dollars. So as we had more people maybe leaving private sector, coming into public, or people just hopping around, it became more interesting to schools. It also became more interesting to schools by way of, it's hard to compete on salary and benefits. And if you can't do as much on salary, we're going to say, let's have this benefit program and we're going to put money into that HSA. So I do have a lot of districts now that do have that high deductible health plan with the HSA. I have more, I would say, mid-size and smaller districts that have it as a total replacement, like that's the only plan. But I do have some larger districts that have it as an option, and people have enjoyed that option because then they can make a decision financially for them and their family where they're like, maybe this would work better for me, and like having that as an option. So that's kind of been the evolution. And I hope that helps answer some of that for you.
It does. I appreciate that a lot.
Okay.
My next question is about what information you have from like employee groups, or do we know, obviously, the best case scenario is that health insurance is free for everyone and we can take care of each other like we care about each other. Given that that's not the society that we live in, do you know anything about what MTI thinks or what staff think?
I wouldn't want to speak for MTI, although we have been sharing with them some of these options. I think certainly the fact that it's a choice as opposed to, a full takeover that we're talking about here, I think that makes it more amenable to them. We do certainly hear from employees, not the vast majority, but we hear from employees and even some of our pre-Medicare retirees that are looking for options. Either they were familiar in another job or they know somebody that has one of these and they've asked, is this an option? We do, for our retirees, currently have a health reimbursement account, which Bree also mentioned, and sometimes people, they don't know the difference, and so they're asking questions. Well, I thought I had one. Well, that's actually different, and a health reimbursement account is an employer account. The employees don't actually
I
own it,
see.
so there are some important differences
Yeah.
because of that. But we do certainly get questions and interest that is expressed in these kinds of accounts, and they really like the idea, I would say, of being able to carry over unused funds from year to year. I think that really is appealing to a segment of our employees.
Okay. Can you talk me through any downsides to the option for a high deductible insurance option?
Would you want me to?
What?
Yeah, sure, for sure.
And I mean, organizational downsides. I understand that this is a choice that an individual would and can have downsides if this is the year that you get in a big bike accident or something.
So for MMSD as a district adopting this, I think the piece that's important to think about is funding that HSA. So, there's a decision, you want to do that as a district. I will not push you either way, but I will just say best practices, what's been successful in a lot of schools has been putting some amount in that HSA account to help people start up, right? It's a big leap for some people to go to that high deductible plan, and it's helpful if the employer is contributing. That's something that if it is of interest that, we've thought about, we've modeled out, we can easily present to the board and talk about that in further detail. But that would be, I think, a financial investment. I don't know if that's definitely a con, but it is more money
Sure,
from the
consideration.
district's budget to.
And that would impact the potential savings that's here. Or is
And
this
actually-
part of the model?
I neglected to include this on, or mention this on the slide, but the assumption, that estimate that I provided does assume that we would contribute $1,000 to an individual plan and 2,000 to a family. So that is factored.
Gotcha.
The other thing I mentioned is that we would have to work with an administrator to administer the health savings account. We do currently for our flex spending account and that retiree HRA. We already contract with EBC, Employee Benefits Corp. They certainly are an option for doing that as well. But there are other options that we would. I would say that based on the administrative costs, based on what I've seen, it would be pretty minimal compared to, the HSA contribution and other factors.
Got it.
And I can't underestimate the importance of education. I mean, that will be an effort on our part to make sure we're getting the information out there, but then also getting that engagement back from the employees.
Yep, okay.
And I do suspect it will increase over time. I know I used to work for the state employee health plan. They had their high deductible health plan for 10 years before they had sizable enrollment in.
I appreciate all that extra info. I think from my position as a board member, just looking at our budget and looking at these year-over-year increases, I don't see a way that we can continue to just continue to absorb that at this moment. So I appreciate these options. The option I find myself most interested in is option 1. I don't have any interest in going away from the tiered setup, but I am curious about working in collaboration with our labor partners on what it would look like to make that increase. And then I guess I keep zooming out. And so it's just the thing I keep doing to contextualize that, when we talk about why people go into education, there's the love of learning, there's the love of the work. Nothing replaces that. But it used to be that you had a lot of autonomy in your classroom and you had excellent benefits, but there was assumptions about what it would mean to have that type of job that are changing. And so as we say, oh, well, maybe it's not going to be the best and most affordable ever. I want to be thinking as a group about okay, well, then besides the love of the work, what else? And my particular interest is around professional development and how we support people to grow in their craft. So I want to really appreciate you for bringing this and appreciate my colleagues for taking the time to really think deeply about how we approach this, just ballooning cost to ensure employees in MSD. That's it for me.
All right, thank you, Board Chair Nichols.
Okay, thank you, Chair Castro. Thank you for the options. It's super helpful to see the direction we might go. So I'm gonna say this, I think I already know the answer, but I just want to say it out loud. In option 1, if we were to have employees pick up an increase in the premiums, that's coming automatically deducted from their payroll, right, their paycheck. And that does not prevent an employee from picking or contributing to their flex account.
Correct.
Correct? So you could potentially, even if you were paying more through your paycheck, also decide that you may want to contribute out of your paycheck to your flex account, but the flex account then would allow you to submit your co-pays, your prescription expenses, and other related expenses to get reimbursed. So you might feel like, although the premium went up, if you can afford to contribute to the flex account, you have a way to at least get some money back.
That's correct.
Okay. For option 2, which is the deductible has to be paid out of pocket first.
Correct.
Yeah.
With the exception of the preventive services. But yes, the deductible is paid first, and then the plan would start to pick up costs that you have, your dean or your courts.
Okay. And again, you mentioned the flex accounts on option 2, but and flex accounts can also be on option one.
Correct.
Okay. And then for the third option around the health savings account, thank you to board member Mosner Feltham for your questions. I do have a couple of additional questions, which is if there are, and I know that you all are estimating that if we were to add this option, to me, this is a add to option one or add to option two. It's like an additional, isn't it?
You could do it on its own, or you could do it in addition to the other.
Okay. Because it's not a standalone, because there aren't enough employees that would elect or qualify. Is that right?
We expect interest in the first year will be low, just because it will take a while for employees to enroll in the high deductible health plan option. And actually, if you did both option 3 and option 1, you know, I mentioned we need those incentives in order to encourage people to participate in the high deductible health plan. If the percentage of the premium goes up, that will actually help with that incentive, because then you could have a lower percentage for the people choosing the high deductible health plan. So if it goes up to 4.5% for the EAs, for example, you could have the premium for the high deductible health plan be 1%. And it would be 1% of a much lower rate. So there'd be a significant difference in the amount of out-of-pocket premium that comes from their paycheck between the high deductible plan and the traditional.
But the high deductible health plan would be in addition to the current dual choice option we have today. It would be yet another option for them to choose from.
Right, so I think that is one of my questions. So right now we have 2 providers. If you're an employee that wants the high deductible, where are you getting your care?
You could choose either dean or courts, just like you can.
Oh, so you could still make a similar choice.
We add it to both carriers as an option, so that
Oh.
plan would show up for our dean folks and our courts folks. Yes.
Okay. And the benefit for the employee to go into the high deductible health plan, in layman's terms, is what?
The incentive.
What's the benefit?
So it's lower, it would be a lower premium. But
Okay.
the rate itself that the carriers charge us would be less
Okay,
than our current plan. Also, the estimate that I put together assumed that the percentage of the premium that they paid would be less. So again, very significant difference in the amount the employees pay out of their paycheck for the premium. It would be significantly lower. Also, it would be paired with that health savings account, which the district contribute to every year. And if they didn't use that, it could help reimburse their out-of-pocket cost. But if they didn't use it to reimburse their out-of-pocket costs, those funds could accumulate year after year after year, and then they would have it to help pay for their Medicare costs when they get to be Medicare.
okay,
It can also be a savings.
okay. And employees would, right now, if they were to opt in, you said in the presentation that would be the only plan they would have.
So they would have to take the high deductible health plan to get the HSA.
Oh,
Those
to
two
get
have
the
to be-
HSA,
you
okay,
have to
thank you,
care-
okay. Okay. You mentioned that there is an administrative fee with the HSA, is that correct? Okay. Can I ask if there are employees who would, if we were to offer a high deductible health plan, would that require additional human resources on our benefits team? Cause I'm I just wanted to make sure as we're thinking about other types of benefits for employees, what the internal capacity is to manage new options.
The internal cost to MMSD and HR we'd have to do some setup, right? There'd be some contract administration and making some changes in the system itself, but those would mostly be initial costs, initial effort. On an ongoing basis, it's really going to be around the education piece. On the administrative costs that I mentioned, that would really be for a vendor to administer these health savings accounts.
Oh, so it would be like an external
Yes.
group, okay. So you're not anticipating additional HR FTE to help manage this offering? Okay. I think that answers all of my questions. Given just the ballooning costs of healthcare, I feel like healthcare is a really important benefit for our employees, and we should try to maintain as much as we possibly can. I also, of option 1 and 2, I guess as of today, think about this more, but as of today, I feel like maybe looking at the tiered increase in the premiums might not feel as dramatic as like an out-of-pocket deductible, even though it is still coming out from the employee, but it's spread out over paychecks. And may not feel as hard when you're initially moving in a direction of a price increase. I like the idea of offering option 3 based on what you've explained. So adding it as an option. And my last question, Chair Castro, is the high deductible health plan, if you have a certain number of employees who opt into that, is there some thinking that would improve our ratio, our utilization, our claims ratio after some time, or is it not related?
I knew you'd want me to take that. Okay, so this is how we can look at it.
Okay.
right? Right now, we're 2 MMSDs, right? We have our dean population, we have our courts, right? And we get different renewals and they're different populations of health, right? Different risk levels. So now, but we have the same plans, right? So we have the same plans. So when courts does their underwriting to take a look at us, they're looking at, our plans as a whole, how we're running, that's to everybody. So when you add options, when you add other plan options, they will still give us 1 renewal increase, right? But they're going to look at how is that population of the health running on this high deductible health plan versus our folks that are on our HMO. They're going to look at that. What happens sometimes is that there's a bit of adverse selection, right? So our healthy folks might really consider and make that move to that high deductible health plan because maybe they don't have a lot of medication they're on, maybe they don't have a lot of health issues. They see this as an opportunity to pay less out of their paycheck and get it, basically a contribution from the district into that HSA. So that's an overtime study that we would do. We would obviously be tracking that, reporting back to you on how the program is going. But it's probably not going to, we're not going to see that kind of an impact for several years because it is an option, right? We're not going to have that much movement. We know this in the beginning, maybe even the first few years, but we will track that to see what that looks like, right? And we're large enough. This is harder in smaller districts where you can really see more of an impact if it's a smaller risk pool to begin with, and you have your healthy folks heading in that high deductible health plan direction, then that, richer low deductible plan tends to tick up higher.
Right.
And quicker. But again, because we are such a large group, I don't predict that would happen for many years or maybe ever, but we would watch that, right? I don't think that would be any reason to not move forward with that option. I'm just letting you know that's how the carriers will look at it when they prepare renewal. Does that make sense?
It does. Do the carriers themselves generally, are they supportive of these high deductible options?
Oh, for sure.
Okay,
They have become very popular. You know, I think, you know, for our size, they're going to like that it's an option, not a total replacement,
Mhm.
because they collect less premium. The carriers do, right? We need the premium to be able to pay the claims. But again, if, you know, we're presenting it as an option, and if we don't have as ton of people on there, we still have a very big risk pool. So we're very,
okay,
we'd be able to handle it.
all right, thank you.
Thank you, Board Member Muldrow, then Board Member Pearson.
Thank you, Chair Castro. You mentioned that we have 3 tiers and that one of the things that could offset some of the rising cost in healthcare would be to increase the contribution of employees in each tier by 2%. So right now, my understanding is that our hourly staff or folks who are making the least in the district are at about 2%.
2.5.
2.5. And so what we would be talking about is almost doubling that person's contribution.
Mhm.
I'm curious about whether or not we've applied an equity lens to say, hey, maybe there is the folks who are making more in our district can contribute the lion's share of that additional cost. So one, we have far more people who are salaried folks than our hourly staff. And the other thing is like the breakdown between the people who are being highest. And I think one of the more complicated things we talk about when we have this conversation is really what the union's impact on it is. And so I do know that for some employee groups, there's a cap, like the most we could go up is to 10%. And I think for that group, we're at about 6%. Is that?
For the teacher in that group, that is at 6% currently, yes.
Okay.
And the handbook lets us go up to
10?
10 or, yeah, 10.
And so we'd be not getting to that same threshold. We wouldn't be going all the way up to 10, but we'd be going up to 8. That's a significant increase to go to 6 from 8, but it's not the same as doubling for somebody who is making the least. And then for our highest paid employees, they're at about 12% right now. And we would bring them up to about 14%. I have some curiosity about how that compares to, you know, every employee working for the state or every employee working, you know, anybody who's not doing this kind of tiered system, what kind of those average contributions look like. I also have some curiosity about if our highest paid employees don't have that cap set by the handbook, does that employee group have the ability to contribute more in a way that we think is reasonably significant in comparison to the other employee groups? I appreciate the agility of what you all are proposing today. I do think like it's great to have options, and diversity in terms of what we're offering means different things to different people. I'm curious about what it looks like to pursue some of what we're talking about. But my primary curiosity is really around kind of that shift in employee contribution and why we want it to be the same for each group, and whether or not that's a truly equitable framework to do it, given the different realities of people's incomes who work for us. The other thing I want to say is I really appreciate Board Member Mosner-Feltham and anybody else who's spoken to the context that we're in. I have some real nervousness about the One Big Beautiful Bill's ability to take effect and influence these kinds of conversations from 2026 to 2034. And the real like implications in terms of prescription costs and the real implications in terms of Medicaid and Medicare. And so I think some of that will put tremendous strain on our system. And I think it is reasonable to mention that political dynamic because I think sometimes we have this conversation as if the health of our employees is what's driving costs. And I disagree with that framework given kind of the current moment we're in politically. I guess I do wanna ask Jennifer if there has been any exploration of how to kind of equitably redistribute this cost among employees beyond simply applying a 2% increase generally.
We chose 2% just as a baseline here, but we have internally talked about doing running other scenarios.
Okay, I guess I would say I would be curious what it looks like to leave our lowest paid staff at 2.5. What it looks like to bring everybody else up 3% versus the 2%. And how those numbers shake out. I also think if we have admin who doesn't have that cap, or our highest paid employees do not have the 10% cap. I'm curious what it would look like to have their contributions be more similar to what we see at the state, which can sometimes be upwards of, I mean, I think over 15% on a regular basis, but could be wrong.
So, yes, we'd be happy to model some other scenarios, as Jennifer said. We just took 2%. It was relatively easy, but we could do other scenarios as well. Yep. For the state employees, generally the premium shares are set at 12% of the second lowest cost plan. So the amount might vary a little bit from 12%. If you choose a more expensive one, you might get less of an employer contribution, but it's generally tied to 12%. What we have seen in other school districts around in Dane County, the 10 to 12% is usually the standard in terms of the premium share. I know at least 2 districts, you pay an additional several percentage points if you're not participating in their wellness programs that are operated through their health plans. So I've seen them as high as 18% if you're not participating in wellness. So that tends to be more standard. Like I said, we're at 6% on average, but it's that tiered approach. So we can certainly look at an option that keeps 2.5% employees at 2.5% and 3% and others, or 3% for everyone else. So.
Thank you so much for that curiosity and for what you presented this evening. That's it for me, Board Chair Castro.
Thank you. Board Member Pearson.
Yeah, thank you. I want to acknowledge my fellow board members in asking really great, thoughtful questions. They were definitely questions that I similarly had, especially around the climate that we're in as things are increasing. We did get Medicaid expanded at the state. We would like it further expanded. With that being said, do we know the percentage of our employees that are not on our healthcare plan, but have access to Badger Care? And if we foresee any folks that are going to be, because of like the changes at the federal level, and how it's in the state, do we foresee them coming home as well?
I don't think we have that data. We do know that there are some employees that do have it. We have employees that will occasionally ask us to fill out forms for Badger Care. It's an employer verification. We do have some, but whether those people are eligible for our insurance plan or not is another question. So what we generally know is about 75% of our employees are eligible for our health plan. And then of those employees, 75% enroll. So at least 25% are not even eligible for our plan. And so they would be the ones more likely to maybe be on Badger Care or some other kind of insurance. The individuals that are eligible but are not on our plan, more likely they are on a spouse.
Oh, yeah. Wow. That's good to know. Likewise, in terms of trying to keep our hourly wage folks in, which I think I'll +1 that. I do think it's important. And then also the other question is that, say I'm an employee for MMSD. Currently I have, say, courts. And say we offer this option of the high deductible plan, the HSA, and say, this year, nothing happens, kiddos are fine. I'm totally fine with paying it because nothing is happening. And say next year, a kid breaks their arm or something like that. Do I have the ability around enrollment then to elect to go back, not to a high deductible plan, or do I have to stay indefinitely once I choose a high deductible plan in that plan for forever?
So you could switch it open enrollment.
Okay.
So you couldn't switch necessarily in the month in which
Right.
that accident happened, but you could switch at the next open enrollment session, which usually runs October 15th through November 15th. And then it would take effect in January.
Okay. So with that being said, I do like the option to give employees that opportunity if they want to choose the high deductible plan. Surely because if they're able to go back to, if something arises in their family and they can make the decision, I think giving that options to folks as possible, I think is important, especially right now. Given the climate that we're in. And so, yeah, that was just my question. Thank you.
One thing I would like to add about the estimate for the high deductible health plan. That estimate was based on the quotes that we got from the health plans, which were based on the current minimum deductible that's allowed under federal law. Because those minimums are indexed to inflation, that deductible will likely have to increase every year. So if you are interested in adopting that kind of option, we could do it at the minimum certainly, but then next year we might have to, and the increases aren't usually that big. It's like $50 for a single plan and maybe $100 for a family plan. If you're not interested in making shifts every year, you might want to start a little bit higher, a little bit above the minimum, so you don't have to adjust every year. So we just don't have estimates for a slightly cheaper option, but that is something to keep in mind.
Does that make sense? I'll just say it has been really challenging with some schools where it feels like, you know, if we do the minimum, now we just have to keep changing each year, and that doesn't feel good. So that's where I've seen more of my schools start off at like a 2,000, 4,000 deductible instead of that minimum. I have a couple private sector clients that kind of fell into the same thing, and they're like, you know what, forget it. You know, it's kind of frustrating to the employees that each year we have to change and creep up a little bit on that deductible. Let's just start off higher to not have to deal with that each year. So that's, to Rachel's point, we can easily get those options if the board is interested in that. And, you know, just to kind of stay away from the minimum, I should say, because then it is most likely going to go up each year.
Thank you. Board member Vandermeer and then board member Saravo.
Thank you, Chair. I just have one brief question. What is a healthy person? That's all.
That's a rhetorical.
Rhetorical question.
No, it's not a rhetorical question. Insurance-wise, is there a legal definition for a healthy person that is covered?
So healthy is a euphemism for someone with few claims or no claims, depending on the scenario where you set that threshold. You know, that's depending on who you're talking to and whatnot, but generally it means people with very few health plan claims.
Thank you.
Board member Saravo.
Thank you, Chair Castro. Just had this kind of one thing. There's been a lot covered here, so it's been good to hear all the different types of feedback, and especially appreciate board member Muldrow's interesting concept of wondering how do we look at equity in healthcare and seeing what that looks like. I'm wondering, do we do feedback from current enrolled people who are currently enrolled, do you do feedback about like where they're at, about if they could change something, or if something was made available where they would go, or is this kind of, we're putting this out there as an option and considering?
We have not surveyed employees, for example, if that's what you're thinking.
Yeah, that's probably a better word for it, yeah.
No, I mean, we certainly do get employees reaching out to us when they have an interest in a particular issue or option. I know we've got, we're gonna talk about dental here in a minute, but you know, that's one where we've had employees ask for something. We've had employees ask about high deductible health plans and health savings accounts, but it's more, you know, up to the individual. Not everybody knows what a high deductible health plan is, so it's not many that's helpful, but yeah, we haven't formalized any kind of survey of employees. We are talking with our labor representatives though about some of these different options. And we've, you know, talked with them about how do they get feedback. I think they're struggling with some of the same challenges, like knowing when to approach them, you know, what kind of interest is there on the board's part, you know, before they reach out to employees. But we have certainly talked with leveraging their relationships with employees to get information as well.
Do you feel that I think last year, one of the discussions was giving, you talk about educating on how to use it, like for instance, using telehealth more often. Have we seen, are you able to see if that helped change how people are accessing their health?
We haven't seen data lately on that. It is information that we can get from the health plan, but we haven't seen anything lately, so we could follow up.
Okay, thank you. That was it. Thank you, Judy.
Thank you, Board Member Pearson.
Yeah, I just have a quick question. For the healthcare option summary chart, if say the board chooses to go with option 1 and option 3 is where I'm seeing like a lot of feedback, does that mean that the savings would be 2.1 million and 700,000, so a total of 2.8 million? Okay. But if we get an updated number based off of if there's to the different scenarios,
Sure.
to see what that might look like.
So what I'm saying is we'll come back, presumably the April meeting with a different premium scenario, one that's more based on equity as Board Member Muldrow laid out.
Yeah.
We also will get updated numbers from the carrier, look at a different high deductible option, maybe 2,000, 4,000, so we don't have to increase the deductible every year.
But based on the scenarios right now, it's about 2.8 million savings if we do 1 and 3 together.
Correct, and keep in mind, 3 is only half year savings.
Right.
So it would double that in the second year.
Okay, thank you.
All right, thank you. Seeing no other questions, I'm just going to ask a quick one and say I would favor some combination of option 1, exploring different percent rate increases with exploring health savings accounts. But when we're talking about the budget savings, the 2.1 million, that is taking from the percentage rate increase, right?
Yes,
Okay.
the renewal rates that we got from the,
Yeah, so
for in the plan.
savings or decreasing the overall cost increase depending on how you look at it. So that's my question, and I think that's it.
It's not new monies.
Yeah,
I see some.
I think it was up from
What does that say?
Board Member Van Reelen, is your hand still up or?
Oh.
Okay. So, all right, well, thank you all for your time tonight.
Dental, can we talk dental?
Oh, yeah, sorry.
Dental always gets forgotten.
Just a few slides, so. This slide shows the current state of our dental plan. So about 3,700 employees are enrolled in dental plan, almost 3,800. We have the 2 plans. We've got a base plan, which is where most employees are right now. And then we also have a buy-up plan. The district contributes 90% of the premium for the base plan. And then employees pay the other 10%, or if they choose the buy-up plan, they pay the difference. And again, about 95% are on the base plan. The difference between the 2 plans is pretty limited. If you want to go to the next slide, Jesse. Oh. I thought it was here, but, the difference between the base plan and the buy-up plan, basically, it's that you get, instead of a $1,200 plan maximum under the base plan, you get a $1,500 plan maximum, so it's about $300 additional dollars. Which isn't significant given the premium increase, which is why we see so many of our employees enrolled in the base plan. So for 26-27, we'll be budgeting $3.8 million for the district's contribution to the dental plan. We are recommending 2 plan changes. The first one there is adding the evidence-based integrated care plan benefit. What this does is it covers additional services for individuals with select chronic conditions or that are pregnant. Now, this is all based on research that shows that when you have poor oral health, it can have an effect on certain chronic conditions, including kidney disease, gum disease, certain high-risk heart conditions, cancers, other immunocompromised conditions. So having more cleanings each year can help keep that bacteria in your mouth to a minimum, which can potentially avoid worse health outcomes. And also same thing, poor oral health has been linked to early births. So that's why the pregnant population is included there. This is one of those benefits where we've had employees come to us and ask for this benefit because their dentists have talked to them about it. Over 90% of Delta's employers actually do provide this benefit, and it's something the dentists are aware of, and they encourage some of their patients to come talk to us about it. We are also recommending that we reduce X-ray coverage under the plan. So the American Dental Association over the last few years has changed its recommendations for how much all of us should be getting X-ray. And it was done in the name of safety. They looked and they realized that people were probably being exposed to more radiation than they needed to, given the benefit from X-rays. So they actually changed their recommendations. And so this plan change, we would go, our coverage will be tied to what the American Dental Association recommends. These 2 changes, one of them would increase the rates a little bit. The other one would reduce the rates a little bit. So it's really a cost neutral change between these. But I would advocate that this is really about providing the best practice in dental care. And so that's why we're recommending these changes. That being said, the rates overall are going to increase 6%. And that is based on dental trend. Unfortunately, some of the same trends, the inflationary trends are affecting dental like they are medical. So we are recommending a 6% rate increase. This is a little bit higher than it's been the last for 2 years in a row, we've got a 4% increase. So this is a little bit higher. We've seen our dental reserves go down a little bit. So we think it would be prudent to increase the rate by 6% this year to make sure that that reserve level doesn't get too low. There is also an administrative this year. We had 3 years where Delta did not increase the administrative rate. So this year they are recommending a 20-cent increase per employee per month. I think that might be almost the end. So this chart shows all of the different renewals that we're looking at. You can see the health insurance, again, 17.3% on average with no plan changes. Dental insurance, the 6% rate increase. Life insurance, there's no recommended rate increase as part of that benefit. Long-term disability, we are on a 3-year rate plan to right-size the premium for that benefit. So that it's in the last year of that plan. So that's 15% rate increase. And then no increase in short-term disability. Any questions?
Board Member Pearson?
So with the rate increase for the dental planner, are we all just recommending that we stay at the same level of like contribution from MMSD first and employee?
We do not have a scenario to make that change. We could certainly do some modeling if the board been looking at that.
I mean, a 6%, so it's approximately 3.8 million right now. not including the 6%.
No, that includes.
That is, it includes the 6%? Okay,
But right now, MMSD covers 90% of premium.
right.
Change.
Right.
Yeah.
I was just wondering if I'm just wondering if there was going to be another scenario that is a change that you guys are giving us an update on. And if we were also looking at any possible changes, but it sounds like that isn't something that we are looking at. It's more so around healthcare. Okay.
Right, the options that we gave you. We are recommending those two other changes I mentioned, but those are rate neutral.
Okay. Okay. That's it. Thanks.
Further question? Board Member Saravo?
Just wondering, what is do you know how many people have the healthcare plan also have to?
There are a few more that have dental than have health. But how many of them have one or the other? We'd have to look at that. I would think most folks do have both, but there certainly are some that only have our dental plan. For example, our dental plan, we have a very good orthodontia benefit, so we cover 100% and we cover it for adults. So it might be if they take the spouses for health, but they take ours for dental. You can also stack dental plans, so you could take your dental plan from your spouse and from MMSD, and you can stack those benefits. So that does happen sometimes as well.
Thanks.
Right. Further? Okay, I think we are good. Thank you.
Thank you. Thank you.
Thank you.
As long as you can log into Pearson Access Next.
Pass it to Scott for the facilities referendum update.
All right, good evening, board and community members. Not a lot to cover here in the month of March for our referendum. But I do want to highlight a few things which we have accomplished here in the past month. We are heavily into receiving bids currently for our phase 1 schools, construction, earthwork, mechanical, electrical, plumbing, and we are seeing some positive news from our bidding standpoint, which should be good for our budget. In addition to that, also coming into March, we are currently on groundbreaking, moving a lot of dirt and earth around both of our referendum phase 1 schools. So our ceremony coming up, and we are already started in our phase 2 schematic drawings, which we'll have our first set to look at for Cherokee and Senate in the next couple of weeks. As we begin for the next couple of months to review what those drawings look like before we come to the board, probably in May, to talk about phase 2 drawings, what those buildings will start to shape to look like in the environment. We are currently actively working with the city of Madison on design premises of what we want to do with our phase 2 schools, and wrapping up our bidding process with hope and expectation potentially coming to the board in April for the GMP, or likely May. Guarantee maximum price for our phase 1 schools. So a lot of heavy design work going on in the background, collecting all the bid information, getting in touch with our community members to start building our new sites. In addition to that, we're doing a lot of public engagement stuff, right? Prepping for that work and coming up in May, taking the information we had in February to form what our schools will look like, with a lot of more engagement to come in the next couple of weeks, is watching some dismissals at our schools and some just traffic patterns that are on our more complex sites to ensure that we have engagement with our community and meeting the expectations, how they currently do. Plus our Tokyo Orchard Ridge families, they've been really good advocating about how they do their pickup and drop off. So we'll spend some time out there next week with the design team, kind of interacting and seeing what the best options we have for those school sites will be. But heavy work, really investigative right now. Starting to put just really getting early on the pen to paper side of it, updating our drawings and design to make sure they meet our criteria for our schools and meeting our budgets. And I do want to remind you on slide number 29, which is the next slide, we are 3 weeks away from our official groundbreaking ceremony. Shaking your head, it's crazy. It's going so fast.
Wow.
Would have been a week and a half from now, but we did move it due to our holiday constraint. So it'll be the Monday after spring break. I encourage everyone to come and enjoy the celebration with us. Again, we will have dirt already moving. It's a pretty wild sight currently. But it's a good celebration to really enjoy as community and ourselves to celebrate the work that's going to happen and we'll be coming forward with our new schools. So again, 3 weeks away, it's coming fast. And that'll be my conclusion for this month's referendum discussion. If I can, any questions?
Right, can't see the Zoom screen. Okay, board member Nichols,
Thank you.
return Nichols.
I just had a follow-up on the one comment you made about there being some positive responses to bids around construction.
Yeah.
Yeah, if you don't mind just elaborating a little bit more on what you can. I know
Yeah.
that sometimes when we're in the bidding process, you can't say a lot, but given just the state of how everything seems to be going in our world and watching prices increasing, I have been curious if yeah, we have looked like we're gonna be able to stay on budget, and if we feel like we've gotten good responses from folks to
Yeah.
help us build these goals.
Yeah, so in the very beginning, we did a very heavy pricing exercise with our CMs. to make
Okay.
sure we kind of know what the market is telling us at the time.
Okay,
Since that time, about 6 months ago, the market has held steady, actually come a little bit down for us. There are some gaps in development in city medicine where some projects have been moved.
okay.
So we've been able to take advantage of like, hey, there's a gap. People are really aggressive into our kind of work. So we're seeing some aggressive numbers come back from some of our partners.
Aggressive meaning competitive.
Competitive.
Okay, yeah.
Very, very competitive.
Okay,
I will tell you, it has been literally a few $1,000s between one company to the next company. It is down to
oh, wow.
really, really.
Okay,
And we've had some really clear choices and some have been very difficult to understand what they might be. And I would say, as far as a budget standpoint, from where we started 6 months ago, we're down maybe 1% or 2% overall. So
Wow.
which is good. We're offsetting inflation and we're seeing some aggressiveness to really want the work.
that's amazing.
It's so far, we're doing okay, and I think we'll continue that trend. We've seen some really positive enlightenment from our contractors looking at this.
Okay,
People are aggressive. They want to show the impact of the community and they're coming out, which is great for us.
very good.
Fantastic.
If I may, what Scott isn't saying is how, in a very humble way, he's also the person responsible for people to contact when they want something added to these jobs. So the discipline that he and his team have shown in maintaining, building these school sites of our dreams, but also staying within the parameters isn't easy either. Consistently reached out to, well, you'd like this, that, the other thing, and before you know it, you could easily be 10, 15, $20 million over. So he's done a really good job of that too, and bringing information back and allowing all of us to get involved where we need to really help him keep things in line with, with these results.
Yeah, thank you.
Thank you. Any further questions? Board member Pearson?
I just somewhat in alignment with Michelle's question. I feel like around this time in the first referendum that we just had, and as we were building, the cost of material like skyrocketed. Are we anticipating that? Because that changed like numbers, or are we still also pretty good with that as well?
We're seeing it hold steady. And fuel costs are questionable right now, but
Yeah.
fuels are very could be.
Okay.
Most of our stuff is being domestically taken, so we're not looking imported stuff where you can see.
Okay.
Most of it's showing up in the USA or close to there.
Okay, that's good to know. Thank you.
And we're ready to buy in bulk if we have to.
Okay,
We're ready.
great. Thank you.
All right, we can Move on to food service update.
All right. I have on the phone or virtually, Josh Perkins is currently in his car. He was at a funeral today, so it's his thing. But he wanted to join to definitely show off where we are in food nutrition. So Josh, I'll give it to you.
Yeah, thanks, Scott. Hopefully I'm coming across audibly. I'm sorry I can't join you all in person tonight, but yes, I'm in the front seat of the car. I think I can get through the deck nevertheless, and I am very proud to share some of the things the team has been doing. I will give you the next slide comes into a brief table of contents, just to kind of let you know the themes that we want to discuss with you tonight. We all know, of course, that it's all about getting as many kids to eat at school as possible. That's the mission of the department. We're trying to do that so that kids are not thinking about their hunger or what they're going to have for the next meal when they're trying to pay attention at school. And we consider ourselves a vital support department. So we wanted to share some student reactions to the meal improvements we've been doing, and then how that ties into meal participation year to date as well. And that will in like manner tie into the fiscal update, which will be the last slide. So if we go to the next slide, please. This is tonight's sample menu. I hope that everybody on their way in actually got a few bites. These are some of the things that it's a modest sampling of some of the new menu items that we've added to the menu this year. I know I shared some of them with you previously in another discussion as well, but we wanted to make sure that you got a taste of those things too, so you know what the kids are experiencing. That's actually coming up on the menu later this week. And so this has been one, this selection has been one that's been really popular this year. The butter chicken we developed, we were able to return rice to the menus, as you know, this year, and that's a great palette for lots of different kinds of dishes. That's a classic. The cilantro rice that you tasted, I hope that you did, is it's a great mix of acid and fresh cilantro, though it's fresh acid in the lime juice, so it kind of perks it up. And then the last dish, we actually developed this as part of the capstone project. In January, I finished up the Chef Ann Healthy Pathways, School Food Pathways Foundation Fellowship. And that was one of the dishes we developed for the salad bars. Really wanted to show the students those bars, as I think you know from prior presentations, they appear first in the line when the students join the service line. And so our point in doing that was we really wanted to see the students, we wanted them to see the care that we're bringing to these new recipe developments as soon as they got in the line and not actually have to wait until an entree selection to see some of that. So that was on your sample menu tonight. Next slide, please. These are just a couple. That's actually the butter chicken on your left-hand side being served at Henderson. I got the chance to talk with several students about what they wanted to see. It was kind of a fun experience because when I went to talk to the students on the day the butter chicken was being served, so what else do you think we should develop? And they said something sesame chicken flavored dish with noodles. I said, actually, that's in the pipeline. You'll be able to get that right in front of you pretty soon. And then on the right-hand side, you see some students enjoying the scratch-made muffins from our Scratch Bakery. Those have been very popular, especially the double chocolate chip. Next slide, please. One of the things I really want to share, the students are the ones who really come in day after day and decide whether they're going to eat the meals or not and what they want to eat. But especially, I think in those younger grades, it's instrumentally important what the parents' perception of our meal program is. We really are sensitive to the fact that these parents are, in many cases, entrusting their students' nutrition for the first time to somebody else who's not in the family, and that's us. You know, we're responsible for feeding those kids in a way that the parents are feeling strong about and confident in. And so a couple of parents shared these remarks with us this school year. I found it very rewarding to read. We're always interested in hearing criticisms as well so we can improve the program, but it is rewarding, especially the first comment here. I think that I wanted to capture the spirit of the fact that this parent, when reached out to us, really expressed, I thought I might not be crazy about the menus, but I really do like what you're doing, and I really like how my daughter is reacting to this. And then the second comment was that showed us that we really were doing something right, because this was a parent who kind of came into this with a preconceived notion about what they thought they could expect or maybe should expect from a school meal program, and was very pleasantly surprised. Really happy that I was able to share that with the entire team as well. And then the second one actually comes from a discussion I had presenting to a PTO group. And that was also fascinating to talk. I do this whenever I can. Fascinating to talk with parents face to face about what their individual experiences have been. They will normally have a lot of strong feedback and immediate firsthand feedback from their students. But one thing that stood out to me about that discussion was I was presenting stuff which, to me and my team, it's very much an everyday affair. We're doing this all the time, and we see this is our stock and trade. So we're highly aware of the new dishes we brought to the menu, what it means to execute them, what it means to pack and distribute them in a way that they can be served and the students have a great experience. But I was surprised to know that a lot of the people in the room didn't really know much about these new dishes that we were doing. And they were happy to hear about them. But again, it was an eye opener for me just to make sure we keep on spreading the word and making sure these new developments are as visible as we can make them. I also feel really glad to have gotten this feedback from parents because I think, especially in those younger grades, again, when students are just coming into the school, that whole household is making the decision about whether or not they think our program is one they want to try. The students are the ones eating the meals, but I know the parents are really paying close attention to whether they want to encourage their students to eat the meals. So this is a very rewarding piece of feedback for me. Next slide, please. This one, I wanted to share a couple of the photo is just a little bit for fun, but I wanted to share something about some local connections we have. We do buy local produce. Sometimes those local produce items are seasonal. Sometimes they're a little limited in the length of time that they can show up in the menus. And what I mean when I say that is the dish you tried tonight, the curried roasted sweet potatoes. We don't serve curried roasted sweet potatoes every day on the salad bar. That would get monotonous. It's also very labor intensive to do some of those things every single day. Some of those produce items are items we want to bring in. We do bring them in seasonally when they're at the peak quality, and we want to feature them to really good effect. But I actually wanted to show off something that has to do with something we do serve every single day, which is milk. So this photo is of me. We had a couple of members of the team go down to Janesville to the Dalgu farm. That's one of the raw milk producers for our milk distributor, Prairie Farms. And they were kind of also to supply me with this map, which shows a number of farms in the southern, actually, it's just got cut off. I think there's a farm up on the northwest side, but you can see down here, right in our neck of the woods, a bunch of the dairy farms that supply raw milk, which ends up going into the same pipeline that gets to MMSD that feeds our students. So, with milk, and that is an every single day item. So I wanted to show that off a little bit. We had a really great time walking around that farm. It is a family farm. That can mean different things, but this felt like a very traditional, what you would expect. Meeting the younger generation who said, "Yep, so here's my grandfather who kind of operated this farm at one point. I'm taking these things over." Saw all aspects of the operation, got the chance to ask a lot of questions, something we don't actually get the chance to do very often. So that was a great thing to do, to kind of check out something that's so close to Madison, but ends up, getting into our students' menus every day. Next slide, please. These next couple of slides are going to go through a brief summary of where we are with meal participation year over year. This first slide is going to show district-wide what the trend is, and it's good news. The trend is we are up breakfast. Breakfast is up 2.6%. So that's a lot more breakfast that we're serving over last year, and lunch is up 4.3% over last year. Again, we are always, that's exactly why we're developing these menu items, doing outreach to PTO groups, all of the things that we're trying to do to make sure that when we develop something, it's not a secret to the students. They may have favorites now, but we want to make sure they know our menu program is dynamic and it's ever evolving. And that's in service of keeping their interest up. So this is good news district-wide. On the second slide, if you'll go to the next one, please, is CEP schools specifically. Lunch is up in CEP schools about 1%, and breakfast, we took a little bit of a hit in CEP schools this year, and we're really working with principals in those schools intensively to figure out what we can do to recover those counts and also even increase them over last year's baseline. So we know we added one CEP school this year, Kennedy, to the prior group of 16. And CEP schools have really been an area of focus for us this year because they represent in a lot of ways sort of an experiment in what will happen or what does happen in the district when there is no administrative or cash cost to meals. All students in those schools have access to the meals. We do encourage them to fill out applications because we know that data helps us with funding, but they're not required to fill out applications to get meals, and we notify them of that in our outgoing communications in summer. So we see this as being a real opportunity for us. We want to find out, once those barriers have already been knocked down, we can kind of remove those from the equation and then say, well, what's left? What would be standing in the way of as many students as possible having access to those meals? So we are really focusing on working with principals of CEP schools this year to get those counts back up. Next slide, please. This is the last one before we get into a little bit of discussion. And this is the trend line for our overall budget or our overall picture year-to-date tracking to budget. So this is as of January 31. We are on track for a similar 2.4 to 2.5 million deficit as last year. And I would just point out, it's good to see that in the context of what I just mentioned. We do have increased food costs, both due to inflation and due to buying more food to supply those added meal counts. But we have been able to do that without adding to the projected deficit. And then there are, of course, also increases in payroll expenditure that need to be offset. But the deficit should hold steady from last year to this year. We're not expecting to see an increase there. There is a January dip noted here in the slide. That 3 payroll month happens pretty much every fiscal year, but it moved around this year. So it skewed the picture just a little bit. I just mentioned the lunch counts. Both breakfast and lunch district-wide are up overall, but lunch is showing the stronger increase at 4.3%. Expenses through January 31 are 3.4% below the expected trend from the adopted budget. So in other words, just outperforming that budget by about 3.4% on expenses. And then participation in revenue, we did see a little bit of a slowdown. It was a strong fall, and then we saw a little bit of a slowdown when we came back from the winter break. We have started looking into the reasons why this might have happened. We are going to continue to monitor this as weather improves in spring. We do think, that we did sort of prove out some examples of where we saw some decreased attendance. Of course, this time of year, we see a lot more illness. Naturally, this hits both staff and students. But we're really shooting for, we see this happen where we have a very strong fall, and we want that strength in numbers to continue throughout the whole course of the year. Can't always get what you want as far as the weather is concerned. And of course, that does hit us too if we have days out of school. But we're going to be continuing to work with, I think one of my takeaways from this is to try to work on a promotional campaign that's a little bit stronger as we come back in from the winter break to recapture that interest. So that's it for my slides for this evening. The next slide is just to ask if you have questions for me.
Thank you so much, Josh. Board member questions? Board member Pierce.
Yeah, thanks. Thank you so much for the update. The last couple months, I had a couple times to help in the lunchrooms in some of the elementaries, and then also the breakfast line in the elementaries. And I just want to say close to food service staff because, it is not hard, it's not easy sitting there making sure that the 4Kers get their breakfast and their lunch, and even some of the older kids making sure that they get through the line. So I wanted to say that.
Well, thank you for your support.
Yeah, absolutely. The thing I wanted just to ask is just about, are we looking to make any changes to just the offerings for like breakfast? As a way to kind of like increase participation, because I know that we kind of have our standard breakfast items that kiddos have access to, but we think that, to your point, Josh, of breaking up the monotony of, having something similar every single day, are we looking to possibly do some innovative things around breakfast?
Yeah, that's a great point for me to take away. I will say one of the things about breakfast as a meal service that can make it a little bit challenging to throw a lot of new things in the mix is the amount of time that kids have to eat breakfast. And so what I mean when I say that is the lunch periods, if there's a lot more going on in the menu, there are a lot more choices that kids have to take in and decide if they want to choose from. That can be a pro and a con. And sometimes at lunch, you're able to present like on the salad bar, a number of different options. And if a kid doesn't want to try the curried roasted sweet potatoes, they're going to find something like fruit on the bar. That's always really popular. And they're like, that's not going to slow me down. I'm going to find a meal I want. With the somewhat limited time at breakfast, it can get quite tight for students to get in the door, and they need to make choices fast. And sometimes, I won't say we don't want to innovate, but I will say I think there's some pressure there to offer a menu that kids can immediately relate to. They're like, I don't have a whole lot of time. I'm gonna need to see a menu that I know I like, because the key thing is to make sure they get fed. But it's a great note, Maya. I appreciate it, and we're still going to look for other options we can offer to keep interest high.
Yeah,
If I can add to that, so part of other districts, just structured breakfast time. Periods of the day, so there's some potential challenges that we'll have in that, plus students come late into school or whatever issues they might be, so we're exploring a few options for next year, whether maybe potentially pre-bagged breakfasts delivered to classrooms, kind of pick a selection of a couple of them that students can get what they get in the room and have breakfast in the classroom. So we're having discussions now with some of the associate soups and some of the principals, but we do recognize some of it becomes repetitive and not always like same cereal every morning, some variety. So there's some challenges, just how it's organized overall. So some things we have to battle through.
yeah, thank you for that. And I know that, during right now, we were doing some breakfast in the classroom just because of, the busing situations and things like that. So I feel like we had a lot of growing pains, but I think there was areas of growth and opportunities for us. So looking forward to seeing what that update looks like. Thank you.
Board Member Saravo?
Thank you, Chair Castro.
Oh, sorry. No, go ahead, sorry.
Thanks for all these updates. My daughter's actually someone who just started doing at lunch this year because she got to watch all of her friends pick whatever they wanted, and so now she wonderfully does it all the time. I think pizza's the most popular one.
Oh, yeah.
It's for that. But I love that she always gets there's a healthy option that's always included in there too, which comes with the salad or something like that on the side, which I think when Blair and I were at the wellness committee, I think the timing was like the highest, but that's probably more on the logistical school side of things, of being able to get through the line and getting access to it was like one of the challenges that kind of seemed to be a recurrent theme, at least from high schoolers. So, and I think when I first came on the board too, like the bakery was just getting up and running. Has that continued to be a really busy place over?
Yeah, we don't do it every day of the week just because we're always fighting through staffing challenges in the winter time when we get call-ins. We actively put it out once or twice a week, trying to push it through our system. Yeah.
I think there were muffins and stuff coming out. So do you get feedback on breakfast choices and vary those depending on what that is as well?
Yeah, of course. One of our biggest push with muffins, given a variety there, to also get away from preservative. You can buy a muffin with plastic wrap, or we can make it with no preservatives, less ingredients, and more healthy. So we're always trying to balance that flavor. And then we get a lot of stuff like, what if you did this? And so we were able to modify a little bit of the recipes too. Like, okay, that makes sense. Versus prepackaged, right? We can morph it to what we're hearing.
Yeah.
We do that quite a bit.
The only feedback I was thinking that we've heard before is like, are there like the fruit options that are available? Is that something that's locally? We saw some of the milk is locally sourced or from around the area. Are fresh fruit or vegetables? I don't know what's always included in there. Is that something that's also?
We typically don't have a lot of fruit in the state of Wisconsin, like strawberries from California, the West Coast. You've got mandarin oranges, obviously in the citrus areas.
Okay.
We have more of the vegetable based stuff here, corn, beans, potatoes. Those are all more Wisconsin based. And we do get some, smaller seasonal things, but nothing for like mass volume. Like we do it once or twice in the fall, depending on apples this season.
Okay.
But, you know, those are a few things that we do far between, but like Michigan's a big apple, a lot of Michigan apples, so.
Well, thanks.
Thank you. Board Member Mosner Feltham.
Thanks. Congratulations, Josh, on the increases year over year. That's great. I have questions. Actually, not about the food service, but about the back end. I don't know if you remember, I think one of the first times, Josh, that I was sitting here that you presented to me, I was like, oh, shoot, I haven't paid my kids like lunch, right? And we were talking about the deficit. I am a parent who can pay for my kids' lunch, and I didn't for both of them because I had forgotten to confirm my email address with School Cafe. I think School Cafe is fine, but we do have like a lot of ways of getting logistical information for parents, for families, right? You've got School Cafe, you've got Infinite Campus, you've got Parent Square, you've got EduClimber when the reading scores come out. I am curious, Josh, if when you think about the unpaid fees, how do you get your head around, how does your team get your head around, and is there anything that we as the board can do to help address some of the like
Yeah, oh,
unpaid
sorry, go ahead.
or for like not for lack of resources? And I've been talking to a lot of people who say the same thing, like, oh, right, I forgot about that. Like, it happened just again. I consider myself like a pretty together person with like, I have internet access at home, I have resources to pay for food, and still I sat here and was like, oh, shoot, I definitely owe MMSD $900 for my kids' food. Like, and my suspicion is that it happens more than just me. And so I'm curious just about how you're getting your head around that and what, if anything, we can do to help.
Yeah, I really appreciate the question.
There's two of them, and the credit card, like I got a new credit card and I didn't put it in, and School Cafe didn't email me until now. Yes, so it was $900.
Yeah, I will just say that to the extent that's possible, we always try to encourage people to get involved with School Cafe, to set up an account. It's really easy, and the reason we do is because you can manage, and it is the best way and the most transparent way and responsive way to manage meal accounts. But whenever I get the chance, I tell people that's also the way that if there's a menu change, which is really high stakes for a lot of people, especially if they want to try something. And they want to say, I want to make sure if my kid has their heart set on this, I'm giving you a shot that I know if something changes. And that is how that happens. So I'm really always, you're right. There are multiple systems that in the district by which parents get information. School Cafe is ours, for lack of a better word. All our functions are applications for meal benefits, our management of funds that have to do with meal fees, and also notifications of menu changes. They're all in there. So as much as possible, I really try to encourage people to just create an account. You don't have to. You can view menus as a guest in School Cafe. You can apply for benefits as a guest in School Cafe. It doesn't really have a high barrier to entry, but once you create an account, you get all those things, including the reminders, but that is kind of our central system. So that's what I really try to push.
First, I don't expect or want you to move away from the system that works for you. I'm just thinking about like, as a system, it's a lot. And I wonder how many other families and like how much funding at the end of the year when we say, oh, it's $2.5 million, like how much of that money is coming from families like mine who got lost in the sauce, in the delicious warm spices sauce, and failed to pay on time. And I appreciate a lot about MMSD that we will feed children. I can't remember the full name, the USDA reimbursement, the meal. We will feed kids, whether or not like mine, they have a negative balance. I just wonder about that, and maybe it's not a question for you, but a question for us as a,
Mhm.
as like, I don't know, tech wise. And then I guess the next thing I'm thinking, and I apologize for rambling, Chair, is, like we have school-based people who are, communicating with families, might there be an opening for school-based people to understand this a little bit more and be communicating with families a little bit more? That's just an idea. I'm not gonna tell you how to do your job. Thank you for the presentation and congrats on the increase. That's all.
Thank you so much.
Thank you. Any further board member questions? Oh,
Board President.
board chair.
Yeah, mine isn't a question. It's also just to say, really appreciate the update and really appreciate hearing, upward trends, around overall participation. I know like even a year ago, that was a big part of the conversation was how to get participation up. And I appreciate just the analysis for our CEP schools around the difference between breakfast and lunch and just watching that and, you know, kind of paying attention. So I think that I just appreciate the updates. And I also appreciate getting the update on the overall, kind of deficit, Fund 50 deficit, because I know over a year ago, we were presented with a plan on how to get Fund 50 back into a good place. And so to see that deficit is pretty much holding steady, and hasn't spiked upwards, I think is good to hear. So no questions, but thank you.
Thank you. All right, thank you so much, Scott and Josh. Moving forward to allocations.
All right. I'll start us off on staffing and allocation process, and any difficult questions I'll pass off to Dr. Stanford, who is sitting about it. So be ready, Carla. Okay. All right, Jess, we go to the next slide. The allocation process really begins, and we have conversations with throughout, they're literally months on long, plural months, conversations about what our enrollment's looking like, but we always return to or class size policy. And you had the classroom size report presented by Cindy and Grady last week in terms of the K4 class size policies. So we have more staff at K4, but we really try to stay focused on the optimum size. When we're looking at sections, as we talked during the instruction work group, and then try to stay as much as we can above the minimum class size, and very few times do we get up into the maximum class size, as we talked on the class size policy. And so the AGR and non-AGR are really based on income, but that's the original savings program that was income based, and we're participating at the time. We continue to participate in the AGR program. So school is in AGR, eligible for AGR funding. The class sizes are reduced as for policy. Next slide. So this is a visual representation of when we start the allocation process. It really happens around November or thereabouts, after we get some final kind of third Friday September counts. It is really the starting point. And the first big decision we need to make every year is, what are we going to do about enrollment projections? Because enrollment projections are difficult to do a full 6 to 9 months in advance. So this year, what we decided to do was to take, first we stayed level on 4-year-old kindergarten. We stayed level on 5-year-old kindergarten. And then we just moved the grades forward. What I like, just roll the grades forward. So if you were in first grade at a school, we assume all the kids in first grade are going to stay in second grade. And that's really the first assumption we make. we do not retain 100% of our students as they advance through our system, but our projections for 26-27 make the assumption that we will retain 100% of our students. From my perspective, kind of overall takeaway, so from my perspective, we are already really gonna be less than optimum. If our target's optimum and my projection is saying all first graders are gonna retain the second grade, I know we're gonna be somewhere below the optimum if we staff at up. That was the first big assumption. Doing that roll forward grade, K4 and K5 constant, we basically stay about even. There's a little bit of drop at elementary school, a few hundred kids increase at middle school, a few hundred kids decrease at high school, but overall projection, although they're changing obviously as we go from one grade to another in terms of the school building, there's some shifting of school building allocations. There's some shifting of sections as we go through the system. That's really our first assumption. And then we talked about the class size parameters are the Board of Education policies, AGR and non-AGR. Special education, it's a completely separate process. It's not based on the number of kids in a section. It's based on our caseloads that Nancy Molfender, Dr. Molfender and her staff and student services work with principals on estimating the students that are going to be there. Any new kids that came into the system since our third Friday in September. So basically from January to February, students that started or enrolled where we know we needed staff or had to add staff this year, we want to account for that as we move forward. Those are much more detailed conversations as we look to staff sufficient to implement the IEPs that obviously are required under federal and state. Then that's also an area where we have significant changes after we released the preliminary workbooks February 13th this year, that Friday. I saw a lot of changes this year in terms of principals are allowed to take a look at CC staff or SEA staff. Seen more this year where a principal would say had 2 SEAs this year, but had an opportunity to convert those 2 SEAs to a CC teacher, right? So when we're looking at staff allocations, if you have 2 SEAs and make 1 CC teacher, because the conversions are based on total cost to the budget, right? 2 SEAs are a little bit more than the cost of 1 CC teacher. But to maintain the budget integrity, you really move up and down on staff allocation, right? But those are decisions that are individual principals to meet the needs of the students, right? They may have converted a CC teacher this year because they had a vacancy they could not fill, but they could fill 2 SEAs. So they want to kind of return to that CC model as you look at 26-27. And then the dual language immersion and bilingual staffing, that is separate process that we here at central office led by Leah and her team really work at what we need to staff the kids and the space that we have for the DLI programs. It's really separate from the other staff in terms of ELI. So DLI is really controlled by Leah and us at central office looking at capacity and students involved, right? Principals aren't allowed to take through the conversion or allocation process, a teacher that we have assigned to DLI, convert that to a teacher to support some other section at that school, right? That's to make sure we have enough staff to staff our dual language immersion at a different location. Okay, so then from February 13th, when we give the initial allocations for those next 2 weeks, this is an intensive 2 weeks. Jennifer Kendall, John, and talent partners on the HR team, working with the department heads, school principals. They all get together at Holtzman. I try to stay away from Holtzman for those 2 weeks. Participate in the virtual meetings that we run down 2 hours at the end of the day. It's much better for me that way. But a lot of intense staff, a lot of long hours from my team, the folks that are working on the pulling of the position, Jennifer and her team, and John. And I say I've done 3 processes here, really here. The tail end of the one 3 years ago, but the last 2 this year, I think this year was much better. I think learned some lessons. I think we really worked with principals last fall to get them ready for what was our system, what is our process, where do you have input? These are the parameters of what we allow to convert staff and focus the needs of your students and families. So I think they're never easy conversations. It's a difficult conversation because it's very labor intensive, but I think it went really smooth all in all this year compared to last year. So that's what happens on February 13th. But before that, as we give the initial allocations, we work with the area associates, Dr. Gothard, Dr. McCray. We take a look at those preliminary allocations. And normally it's adding staff back after I take my first shot at it because, you know, optimum is good, but I like to keep us lean towards the maximum. So when we go through, if we want to see a reduction in staff, it's usually because I stay within board policy, but there's a little bit of latitude in terms of how we split a section. Are we close to optimum?
Yeah.
Really the guiding line first time through is stay above that minimum class size, right? But remember the board policy, there's quite a bit of difference in a section from minimum to 22, right? From 15 to 22. So you have some latitude in there in terms of how we take a look at the process holistically. Title I funding, we talked about the allocations, that goes up and down depending on the school's income in terms of socioeconomic number of students. Those staffing decisions have to be coordinated with Jennifer Waldner, who's our lead on federal aid in the covered programs, working with the principals, trying to fill the needs of where they see in terms of students. So that's that's also one of those special standalone. And then the other issues that I talked about in terms of the process that went from February 13th until the week before last, in terms of when we closed that initial phase to kind of go through everything and double check our process and prepare for the surplus process and eventually the mega postings that will happen. All right, so that's all the background information, all the good stuff. The next slide is a summary, and there's a couple of things that always makes me a little bit uneasy about this process because there's never a set stone number of allocated staff. The system I explained to you, we're looking at specific changes or anything that would come up in terms of families that are entering our systems with IEPs, to principals converting two SEAs to one CC, or anything through in terms of creating a dean of students or adding some EEA staff or an EA staff. So these are truly points in time to compare from one year to the next. I know for certain in another 3 to 4 weeks, these are going to change, right? But these are what we believe in terms of the comparison, 25, 26. This is a summary. The next 3 slides will look in more detail by classification for elementary, middle, and high school. But overall, an increase of 9.8 at elementary, an increase of 4.8 at middle school, a decrease of 3.8, 3.9 at high school. Overall, this year compared to last year, increase of 10.75 staff. So percentage wise, almost steady, right? Almost level. Now, there are changes from building to building, right? That's really important also. Okay, Jesse, next one. So this is elementary school workbook. And I gotta say, I'm regretting a little bit creating this for the first time last year, because it's a lot of work. This is considerable work to take the different times to add up the elementary schools, because there's a little bit of manual work involved in this. We're still are working on a better in-house tool for our workbook.
I got it.
Builds character allocation process. What was that? Builds character. That's same. You sound like you've been sitting in some of my meetings with my staff when they're like, "Oh, this is close." I'm like, "It's close, but it's not quite right." Right? Yeah. Okay.
Hey, Bob.
So there could still be, a couple of mistakes here or there, but no, this is pretty. So you can see the summary that I shared with you is on top slide 9.7. The overall. They're all positions at the schools, including Title I, including cross-categorical and special education assistants. including the clericals and principals and assistant principals. In terms of the comparison from year to year. I'm not gonna read each one of the lines, but you can see some of the shifts in terms of comparison from the year before. I will say one of the bigger areas in terms of increase is our continued investment in 4K, right? We're adding 4K sections, not only the halftime, but we're adding full day 4K Monday through Friday.
Yeah.
And so every section we add there results in about 2.2 FTE in classroom teacher, in terms of specials, in terms of EA assistants, because we have those 2 adults in every 4K section. And so that's really where you see the ads. It's really us investing more in our 4K programming. Okay, next slide. Again, this is middle school, in total, 4.815 FTE, the just under 1% increase in terms of staff. The bigger changes are both with the teachers here and the EAs. And again, this is post-conversion in terms of the conversions from EAs to teacher or teacher to E, right? This is the process that really came to a conclusion about a week ago, a little over a week ago. All right, then high school. High school is the same. The big area of add in terms of the FTE is the EA units, right? In terms of that, you can add EA. There were a reduction in the teacher flex pool at high school. We're projecting for the second year in a row, 300 to 400 student decline at our high schools, right? Our high school population decreasing. We're putting some more kids in the elementary, an increase in middle school, but at this time, it's an area where, it's kind of new for us in terms of the kids attending high school at one of the comprehensive schools, Capital and then Shabazz, right? So we'll continue to take a look at that, but really that's the driving force behind the decrease in allocation to high school. So we just have fewer students than 3 years ago. Okay. Open for discussion. Question.
Thank you, Board Member Pearson.
Yeah, I had a question just about the high school allocations, and the declining enrollment that you're mentioning. Do we have a understanding as to why the 400? It seems that it's happening kind of. I guess I have my guesses of why it's happening, but if there's any analysis, and how does programs like STEM Academy and some of our early academies kind of affect kind of the allocations and whatnot, for high school specifically, because those students usually are not within.
Right. I'll answer the easy part and then I'll hand it over to Cindy and Carlos for the heavy lifting.
Yeah.
Really, our 12th grade classes the last 2 years are larger than our incoming freshman class. That's really the population shift. But we do have additional alternatives, and I'll let Carlos talk about the STEM Academy and actions there.
Yeah, good evening, board members, and thank you, Bob. I'll start. I want to add one thing to what Bob said also that we have learned is that we have high mobility out at middle school, where we see students leaving the district at middle school, which is also causing smaller class sizes to come into the high school. We do see an uptick of some of those students coming back to us, but I think over the last 4 years in our analysis, we're starting to see the effects of that into these smaller class sizes coming into high school. In addition to that, this year we did try to account for the over 250 students that leave us full time for these amazing opportunities, such as STEM Academy. And we haven't accounted for that in the past. And we've recognized that while it isn't clean sections, but it is large numbers of students. And so we tried to look at that by each school based on the current enrollments for accounting for a little bit of the decline as well. Maya, did you have a second question that I didn't answer?
No, I think it was,
Okay.
you paired both of them together. Thank you. And I know with our academies, although we're growing the different options, so I thank you for adding it this year of kind of making sure that we have that information. And hopefully we'll continue adding it as the options even grow for our students. I guess it's just what to be expected in the future if we continue to grow those opportunities, which are great. And if we're seeing like more students wanting to be a part of them. Of course, I know we had to limit the space. I think this past year stays very status quo with the amount of offerings that we were able to give to students. And if that is the case and we're growing them and there's more participation, what we kind of see as like the future for some allocations in for high school.
Yeah, that's a great question. I think we're going to continue to create opportunities, but we're trying to create more opportunities on our campuses as much as possible. So a reminder, the board approved this fiscal year to invest in staff getting certified to teach dual credit English and math so that we can have students access those opportunities on our campus. We're continuing to think through that for CTE and create the opportunities for the industry certification on our campuses. There may be a little bit of growth that happens to off-site opportunities if it's to support licensure or to continue with some of the academies, but the goal moving forward is to be able to create more of them on our campuses so we don't have kind of this the situations we have now, which is great, but also creates some staffing flexibility or staffing shifts that our schools are going through right now. I don't have a good word for that, but hopefully that makes sense.
No, that makes sense, and it's something that I've thought about too. So no, thank you so much, Cindy, for naming that. That's it for me for right now.
Thank you. Board Member Nichols?
All right, thank you. Bob, thanks for all of the work to make the process visible and just helping to outline what the process is, even getting all the way up to the February release and all the different things that are taken into consideration. When it comes to the level workbook snapshots, the elementary, the middle, and then the high school. I am curious on the percent change for all of the IDEA. So like at the elementary, it looks like there was a change of 2.4 FTE, and that's showing like a reduction of 23%. And then at middle school, there's also a change of 2.8 FTE, and then that's like a negative 100%. And yeah, I guess I'm and then at high school. So this is not to call out the math, but it is more to say, I think when you see what looks like, I don't want to say small changes, because they are real FTE, but it starts to paint a negative storyline around what schools are investing in terms of IDEA funds when it comes to categorical teachers and SEAs.
Yeah, that's
So could you just explain that a little bit more, just so I understand what exactly I'm looking at?
And so, yeah, so first I'll talk the big picture and then we'll talk to the specifics.
Thank you.
So our IDA funding, the allocation is gonna be about the same. We think, we don't have it yet for tests, but we're assuming it's gonna be about the same.
Okay.
But some of what we're spending this year in 25-26 is our carryover from the prior year, and our carryover is gonna go down to near nothing as we go into 27. And so that combination, that we're gonna have less IDA funding in total, obviously, most of that's at staff. And then a combination of the state really upping the amount of state aid for high cost special education, so cost over $30,000. I am strategically moving staff off of IDEA and keeping them on local funds so we can maximize our state revenue capture. Because if we use IDEA funding, I cannot claim a high cost special education. So Dr. Mofen and her staff are on the front end working to identify students we believe are gonna be high costs that go above that 30,000 threshold. Where we can get, supposedly the state said up to 50%, but they're not gonna hit that target this year. And potentially they've added money to, in theory, fund 90% of those costs above 30,000. Okay, so when you look at the IDEA CCSE 4K down 2.42.
Yeah,
Go to the line above, the line above is part SEA, but if you, in terms of regular funded SEA, you can see an increase of 3.8, and the EA unit, which includes SEA, increase of 6.8. But then if you drop down, 3 rows down, and just look at special ed CC, which is local funded,
yeah,
they go up 2.512. So although IDEA is down 2.442, we're raising the local FTE up.
thank
So
you.
it's actually.
So it's a funding stream,
It's a funding,
not,
part of it's a funding, but then there's a true
and then,
staff we have
okay,
for special education and student service.
okay, thank you.
So-
I do,
And you, yeah, go
and
ahead.
I know you said this is a snapshot in time and it might change again. I do think, just as a note, that as you're putting together the budget book, there is a narrative that needs to be explained about that. Because otherwise, I think people at first glance could see, it could look like or schools are investing less in special education staff, when in actuality, it's a combination of funding sources being used differently.
Yeah.
And using more of our local funds to really support many of our special education staff.
Yes.
Okay,
Yes.
thank you for clarifying that.
No, it's an excellent point. Okay. You go.
I'm good, thank you.
Board Member Mosner Feltham.
Thank you, Chair. Thank you for bringing this to us, Bob. This is an area that I am, obviously, we all feel super strongly about it. Can you help me understand in the slide where you're describing the allocation process and you say schools consult on instructional design, like what that means or what that could look like in practice?
I would do a terrible job of explaining, but Trent City, you can do an excellent job.
So I can start and then, so what they do is they essentially, when they get their workbooks, they put together their instructional design, which looks at the number of sections that they might have, an elementary number of CT teachers that they have, all of their support staff. They make the design of their instructional support according to their allocation. When they have that put together, they work with their associate to see where there might be some needs for some adjustments that need to be made, or there might be a need for some advocacy where they might see some gaps in the instructional design that they need to support students and what they've been allocated.
Would you mind like putting a little like, can you give me like an example? Like at a pretend school? Cause when I see instructional design, I think like, okay, let's be creative about how we wanna like actually go through our school days and all that type of thing. And, you know, I think about like, for example, Badger Rock's instructional design was like very clear about how many students and what those classes are and how they move through those. But the explanation that you gave me is not quite landing. Do you mind like an example or something?
So at an elementary school, right, we give them guidance as far as what can be converted and what can't be converted,
I see.
and what they need to have as their base for specific positions within a school.
Got it.
So-
You must have your PBIS coach.
Yes, so you
Okay.
must have a PBS coach, you must hold at least a 0.5 PBS coach. You can convert another 0.5 into something else. That's where the flexibility comes in.
I understand. That's helpful. Thank you.
Okay.
Connected with that, I would really love to see a blank workbook. It would help me a lot to get my head around how this looks on your end. Because I really know how it looks on the teacher end, right? And it looks like, oh gosh, this stuff we've been working on is suddenly like destroyed, whether or not like it makes number sense. So I would really love to see a blank workbook. No, I'm gonna not ask that question. something that I hear from staff in schools is, central office is never using the right numbers. Like they're always saying that you're smiling, because I'm sure you hear this too. Can you help me understand where the disconnect is there? Or can somebody help me understand where the disconnect is there?
I think part of the disconnect is, or part of the challenge, is that we allocate based on a moment in time. And so they can look at what the needs currently are, but we have allocated from a specific moment in time. So when they get allocation, they could see that there are additional needs that need to be addressed that were not caught or addressed when we did allocation in the beginning.
I understand. And that gets addressed later on in the process in that negotiation and conversation.
Correct.
Understood. That's helpful. The other thing that comes to mind when I'm looking at school-based allocation, thinking about that, is it's hard for me to make sense of our school-based allocation without an understanding of like, we have other people in other roles that aren't listed here and how that balances. Board Member Muldrow has talked a little bit about like, okay, if we're decreasing in students in this area, we need fewer teachers perhaps, but do we also need fewer teacher leaders? And not that I expect any answer to that, and this is an allocation presentation, but I think something I'm looking forward to is understanding this in conjunction with all the other people who we pay, who do important work, who aren't represented here. Last question is for Joe. I'm so glad that you're here with your experience from other districts. I would love to know what you think we do really well in our allocation process, and what, if anything, you've seen elsewhere that you think might be applicable here or might be an improvement here.
Yeah, thank you, Board Member Mosterfeld. Just a few general comments first. Very grateful to our community. I mean, the $20 million in additional funds that we're able to build our base with next year is the equivalent of 100 average price teachers. So think about that. Without the support of our referendum, to think how upside down we would be staffing and what we might have to do. So very thankful for that. The fact that we are down students, but up overall aggregate 10.7 is a really positive thing as well. I think that demonstrates our willingness to work creatively with schools, to try to not hold them harmless, but to ensure that it's a great school experience for all students. I mentioned, I think it was last week, maybe in one of our retreats, they all kind of blur together. I think there were 19 sections in elementary school that fell under 15. Our ability to adjust those allocations so that we can remain as balanced as possible, again, I think says a lot about our willingness to work together. Those aren't easy things to do. You know, you hear, you know, these things. You've agreed to a policy and you have directed me to follow the policy. So that's our work. At the middle school level, something I'm deeply committed to because I've just seen in my own experiences, and I thought it was a Madison thing until I left and saw the same thing in other districts as well. When you have an enrollment-based allocation at middle school, but you want to create a middle school model that's based on a structure. For example, you could have 20 fewer students at a middle school, 7 each grade. And by allocation formulas, you might say you need less, or you're going to, but how can you change your structure? You still have to do the exact same things. I mean, if you have an exploratory wheel, you have homerooms, you have teams.
Yeah.
You can't just take a big piece of that out. And I've seen in my career, middle school, build, break down, just this cycle, you know, that can really change and be really difficult. I have been, the team will tell you, championing the funding of a structure in middle school so we can get really sound and structured at what we do. Some of the initial feedback is that there are going to be CTEs that schools have dreamed of, they've never been able to do. And I think that's what I've heard from our community. That's what we're building in the new schools. You know, so it's really building towards that. The priorities of our community are being heard, and we're maximizing our allocation to the best of our abilities to those priorities. The high school level is hard, and here's why. You've got graduation requirements. So it chops up a lot of it right there. You must have, so many sections so you can meet your graduation requirements. But we also all know that this world our are living in right now is limitless in terms of what they want to do and be exposed to. And guess what? You can't offer it all. Sometimes you can't offer it because you don't have teachers who are certified. Sometimes you can't offer it because you can't have 100 sections. You just can't. So those decisions are very course requests based on student conflicts and schedules. Can't offer every single elective the same block or the same period. They conflict with each other. So I would say the high schools have a really difficult challenge, and a number of their students attending, off campus as well. So I think that's one area that, we need to continue to work on. What is the future of high school? We were saying that 25 years ago, oh my gosh. And we're still saying it. What is the future of high school? And I'm pleased where we're at. I think we're doing some really great things. And again, the ability for us to sustain this is going to be based on discipline to our policies, to our priorities, and continuing to advocate for funding. Guess what? This process is not going to get any more inexpensive. It just is. We'll be realistic in that, make sure that very best we can with what we have. And I think, again, 10.7 up, we're down a few students. I think we're maximizing it. And I feel really good about it.
That's all from me, Chair.
Thank you. All right, any other board member questions? Okay, I have two questions. One, what is the current estimate for our allocated staff? And then throughout the year, I've heard a desire from some building leaders and from some parents about perhaps thinking that an IIP program might be best for some students. Have we looked at the increasing capacity for those programs?
I'll answer the first one and then I'll let Cindy go let your answer the second one. This first one, again, question. Right now, I don't have a budget line item for the unallocated pool. I would say we've been anywhere from 20 to 25 the last few years. Given, we'll talk about that in a little bit, but given the state of our lack of base revenues compared to base building expenditure, if I'd have to pick a number that I think we might be able to do, but the unknown, depending on what the state does, is about an unallocated pool of 10 FTE going into 26, 27. And I say that knowing 3 years ago, we would have an unallocated pool of 20 that we would add into the system. But the first thing we would do when we look at allocations for next year is back that 20 out of the allocation pool, right? But for the last 3 years, we kept the unallocated pool within the base. So when we're talking about adding 10, if we would have been doing the practice that the board used to do 4 years ago, we'd have 6 less FTE in our system, actually 5 less FTE system. We kept those in the base as we've tried to deal with expanding 4K, expanding DLI, expanding the option that we need to do. So I think 10 unallocated would put us in a position where we can meet the needs where we really need to meet them as we get closer to third Friday of September. I also think we're gonna have to be more vigilant, taking a look at when we start seeing actual registrations, if we need to allocate staff, move them from one school building to the next, right? It's always a difficult thing to do, but we need to be watching that more vigilantly this year in terms of strategically looking at those.
Got it, thank you. Sure.
For your second question, interestingly enough, my friends and I were talking about that today, and so she's come on screen and she'll be able to address that for you.
Thank you, Dr. Stanford, and thank you for your question, Board Member Castro. So I definitely would always be happy to have additional conversations and share specifics about our referral process for our intensive intervention programs in the district. We do offer intensive intervention programs for elementary, middle, and high school students at the Holtzman Learning Center. Obviously on the side opposite where the professional learning occurs. We have some great spaces and some fantastic programming happening there. We also have school-based programming for intensive intervention program services for students with those needs at each level. And again, I'd really always welcome an additional conversation about it, but we recognize that when a student may have those needs, we need to walk through the referral process, talk with the team. Oftentimes we'll go in and conduct some observations, either the director for the level or myself, or sometimes both of us. And I will say that we want to offer those services for every student who needs them. And simultaneously, thinking about our conversation last week, we also want to ensure that we're giving all students an opportunity to be successful in their home schools and in inclusive environments. And so we really work to balance that. And one of the things that we've done over the last few years is that we've moved to a system where the majority of students who receive intensive intervention program services are also receiving some of their education at their home school. We really want to help them have access to core reading, core math, core writing, be with peers who don't have an identified disability. So those are just some of the ways that we move forward through the process and the considerations that we apply when we do that. Did that answer your question, Board Member Castro? Do you have additional questions that I might be able to help answer?
Thank you. Yeah, I guess the perspective I've heard elsewhere was there was a challenge with capacity in these programs. Is there a misperception there?
I would say yes, that there is a misperception that we would, if a student is identified to have those needs and the IEP team must be part of that decision. So if an IEP team determines that that's what a student needs, then we must afford them that opportunity and ensure that there's capacity. And so at this point in time, we've about every month, we look carefully at our capacity in each program, and we do currently have capacity at all 3 levels for students who may have that need. So I really appreciate that follow-up question and the opportunity to respond.
Thank you. Board Member Saravo.
Castro. Appreciate all the questions that people are bringing up here. And board members are bringing up. I was wondering if this might go to the village builders are included in both the elementary and middle school, but not at the high school level. And what determines how many of those the school has access to?
So when the board first approved the village builders, the requirements for schools to receive village builders was that they were ATSI and ATSI designation.
Can you break that down a little?
Additional targeted supports and intervention.
Okay.
So they were designated as ATSI schools.
By DPI.
By DPI, thank you. By DPI. And so we took that data and that information in order to support schools with literacy and engagement and relationship building, and then allocated village builders to those schools based on that. At the time that was also done, we did make adjustments and also included some TSI schools, so targeted support and intervention schools, so that they could also have that additional support with them.
Will we get to see feedback about that particular role, like how that? Why don't we have it in high school? Is it just too much other stuff going on, or is it just viewed differently there as the purpose of particular?
Initially, when it was brought to the board, it was brought to the board as a support for our early literacy plan. And so that's why it was for elementary, and then we also have some for middle school.
Okay.
High schools have a lot of other discretionary support positions too.
I would even say, even thinking about, and Dr. Smith, I don't know if you agree with this one, but MSCs and SCSs are also, so in my head, kind of equivalent to the village builders, and they are located in and the middle school. So they are doing a lot of that engagement work that village builders are doing at the elementary level at the same time. So it's almost like they doing the same thing, but just different titles across. So like village builders in elementary, SCS is in SCS is in elementary, in middle school, and then MSCs are at high school.
Okay, thank you.
Thank you. Hey. Seeing no further questions, Bob, back to you.
Chair Castro. The next is talking about the budget. I was hopeful that we would have a special session called by the governor and the legislature would have approved hundreds of millions of additional state aid. It didn't happen. Did not happen.
Yes.
So I'll just focus on kind of the timeline. Not a whole lot new news because of that's gonna be critical for us. It'll give us likely a few $1 million more this year, several million more dollars for 26, 27. Which really goes a long way in closing that gap that we've been talking about in terms of my preliminary revenue limit projection. And what I consider the continued investments and costs, which is, you know, about a $10 million difference. So getting a few more $1 million this year will make a difference in available revenues moving into next year. More importantly, it really builds that base 27 and 5 point revenues for ongoing costs. We are on target. However, the plan will be to create in May a proposed budget will be the very first level, high level 27 budget that really sets the foundation for the preliminary budget that we'll do in June. And by then, we'll know whether they're coming back to provide, provide the funds to hit the targets they said they were gonna fund in terms of really 42% reimbursement for state special education aids in this year and 45% in 26.7. Statewide, they're off by about $200, which means a lot for all school districts and means quite for us in terms of balanced budget. And then when the summer hits, really we'll start looking more, we'll start getting a sense as late summer comes around in terms of that unallocated pool, but I will, I'm penciling in 10 unallocated right now, which is $1.2 million. We'll need in terms of additional base building expenditures. Oh, so that's kind of really the timeline overall. And then of course, the third Friday, September will really let us know in terms of that revenue picture. I'll continue to look at the revenue projections based on the work MGT is doing that we're going to talk about, I think in 2-3 weeks when we talk as a board in terms of that boundary review and the work done on enrollments. So other than that, really not a whole lot of changes in terms of about 30 million base building revenues and 40 million plus potentially, right? That 40 million plus on costs is the high end of the estimates that I have for health insurance. It's the high end of the estimates I have for potential action on the compensation study that's being conducted right now. But until we get those kind of pieces, we really won't know that. So and hopefully we'll hear in the next month or so the actual allocations for both Title I federal dollars and the other covered programs and also the Individuals with Disability Education Act federal pot of money that we talked about earlier when we were discussing that. I don't have any other prepared remarks, so if there are questions about that, I can answer. Right.
I think we are good. Thanks, Bob.
Sure. Okay, moving on to our proposed policy.
Hey, Lee.
Okay, y'all. So tonight we have our second read for the parental and foster care leave policy. You all will have the red line as well as the clean version in front of you. And Blair is going to start us off with the presentation and then answer possible questions. You want the team to do the presentation?
Yes.
Okay, so team can go ahead and do the presentation, but Blair has been spearheading this work and is open also to answering questions based off of her work as well. Go ahead.
Away, Ms. Brenda. Go.
All right, I'll start us off. So hello again. This, I apologize for the number of words on this screen. And it does start a little abruptly. We did have a slide that described what we thought the first year costs of this proposal would be in terms of substitute costs. We're estimating that first year, we're gonna have about 140 people possibly take this parental leave policy or benefit if it's available to them. That's just looking at the number of parental related leaves we had in 24-25. So that was where we came up with that number of 140. We looked at the numbers. On average, parental leave is about 6 weeks. Or 8 weeks, excuse me. And under this proposal, we're expecting it would increase to 12 weeks. Just because that's, you know, they would still get their salary and still get their health insurance. So we would expect everyone that would be eligible would take the full amount of time available. And then, so we assumed about 933,000 using those numbers in substitute costs, that additional 4 weeks of leave people.
I'm sorry, can I ask a question? Are you saying that all 444 people that would use this policy would be teachers who would have a substitute? So no administrators, no custodians, no food service people, everybody gets a sub.
So we assumed about 80% would require subs, which I think is pretty consistent right now overall of the percentage of employees that have subs. We did not explicitly assume that other employees would have either like a new category of subs or hiring of LTEs, although that is possible.
So we're just at the 933.
3,000.
Yep, for the additional 4 weeks.
So that's that estimate. This slide then goes on to address potential future costs. So if individuals are not using their personal illness accounts to pay for leave or vacation time, they would be able to use that time later. We did not explicitly take that into account. That becomes a much more complex analysis, taking into account a lot of factors, including age when they take the benefit, inflationary costs, how many people leave the district before retirement, et cetera. So there's a lot of variables to that. And so we discussed the possibility of, you know, an actuary might be in a better position to do that kind of longer term. So that's not reflected here. Next slide. In addition, we've identified additional administrative costs that will be required by implementing this new benefit. And they fall into 3 basic. The increase in the need for substitutes is reflected here on this slide. Higher management costs, higher daily and long-term vacancy rates. The HR team will have to expand the pool of substitutes to make sure that we have that covered. Again, if we end up having to expand the substitute pools for certain positions or hire LTEs, that would be additional costs as well in the hiring area. Next slide, please. The additional payroll costs. So this is a new type of pay that would have to be created on an individual basis to make sure that it wasn't available to all employees. So that requires an extensive amount of payroll related work. We would also, the leaves team ends up putting in that additional leave and auditing it. And then there's additional payroll team folks that have to do the additional auditing. So those costs are reflected here on this side. And we also have multiple types of payroll. So it's, some people are paid monthly, some are biweekly. So we have multiple payrolls happening every single month. Next slide, please. And then this one, which has perhaps the most words on it, I apologize. Again, people are going to be on leave for longer. We're expecting about a 50% increase in the length of the leave. There's going to be more complex types of leave with the foster care, pregnancy loss, the NICU stays, and the multiple birth stays. So now we've got more different types of leaves that we have to manage. And the complexity of making sure we're managing all of that with our other types of leave, whether it's FMLA leave or child rearing leave as well. There's going to be more eligibility documentation that we're going to have to collect and maintain. We also create, each individual employee has their own tracker that we will have to maintain. Those are going to be more complex now. And because of the intermittent nature of parental leave, intermittent leaves require a lot of back and forth communication, both with their supervisors and with the employees. People's plans change a lot. And so there's a lot of communication back and forth ways to make sure that, and so the idea with the additional administrative costs is we want to make sure that we're continuing to serve our employees well. And that communication is a huge part of that. That might be oh, sorry. Again, this mentions both block of time and intermittent leave. So again, substitute payroll and leave management costs. If we don't have additional staff to do this, we're going to have to ask other people doing other things to help pitch in. So we will end up reallocating staff from other areas, possibly hire LTEs. Pretty sure that's the, thank you.
Yeah, thank you. Thanks. Thank you to the team who put this all together and for my colleagues who have been working with me on this in our first read and now our second read. I want to remind folks that what happens now is that employees it's common that employees use their sick leave, use their accrued sick leave, and then end up without adequate sick leave for the next few, I don't know. My kids are 7 and it's still an issue. That the sick bank is only available to employees covered in an addendum that I don't remember the number of, that covers our teachers, but not other employees.
Okay.
And the paid parental leave across the world is the standard, is good for families, is good for parents, is good for children, is good for communities. And I see this as a recruitment and retention tool, as well as like honestly part of like enrollment tool, right? Come to Madison. We're gonna be here for your kids from birth fully. So with that, I would love to hear what people's questions and considerations are.
Absolutely. Thank you, Blair. Nikki?
Yes, I don't have questions. I have some comments. My comments are as follows. One, it's about time. And I've said that before, that we have this policy. We've needed it before. The amount of health care that people rack up because they can't do preventative care is massive because they don't have sick leave. This fixes a lot of that. Two, I think it's well written, and I understand that there are going to be some concerns on cost, but I do believe this is an equity issue because it restores the ability for staff to have their children taken care of and have that sick leave when they need it. Three, I think this is an anti-ableist policy as well. Individuals with disabilities, especially those with kids, take more sick leave than other individuals because they require it and their health requires it. 4, we spent earlier tonight discussing the costs and increases of health insurance. If we're going to increase the cost of health insurance, I think we should probably provide something for it. And I think this does a heck of a lot to do that. In sum, I highly, highly, highly suggest, one, that any changes only be made by the authors or the board itself. And two, I think they've done an excellent job. And I urge people to support it, and I respect everything else. I have no further comments. Excellent job, ladies.
Thank you, Nikki. Ollie? Thank you. We've talked a lot about the financial projections related to this policy. And I really look forward to having a firm understanding of how much this policy costs. One of the comments I really struggled with was this idea that more people take leave or more people may even have children in relationship to this policy. And I have a hard time with that because 30% of Americans have no children. And about 2% of people in you know our community give birth every year, and I don't see that skyrocketing. I work in abortion, and I can tell you I work with people who are terminating pregnancies every day, and no one's ever called me and said, actually, never mind, I just found out we have really good leave at my job, so I can, I can do this instead. That being said, I would love for us to have more of a conversation about the benefits of this policy. So I'll start with the benefits to families. Enhanced bonding. Paid leave allows for parents to spend quality time with their newborns and foster strong emotional connections from the start. Improved health outcomes. Parents can be focused on their child's health and well-being and their own health and well-being during the early months, promoting physical and mental health for both parents and child. Reduce financial stress. With a steady income during leave, families can manage expenses better and reduce stress related to lost wages. My family, my partner works for MMSD and went off of payroll, which is not a simple thing, and does require HR staff to be pretty mindful of individuals using their sick time as parental leave. So some of this, I think, oh man, it's got to be kind of easier to pay people than to take people on and off of payroll. But that case has not been made as part of this conversation. Reducing financial stress increases parental satisfaction, knowing they can take time off without financial strain leads to higher satisfaction and less anxiety among new parents. Benefits for the employer. Higher employee retention rate. Offering paid parental leave can increase loyalty and reduce turnover, saving companies recruitment and training costs. 2, increased productivity. Employees who take parental leave often return more focused and engaged, leading to enhanced productivity. Attracting talent. Companies with generous parental leave policies are more appealing to prospective employees, particularly younger generations prioritizing work-life balance. 4, improved workplace morale. Supporting employees during significant life events fosters a positive workplace culture and boosts overall morale. I hope these are things we feel good talking about and have taken into consideration when we're talking about kind of how we analyze a policy like this. Societal benefits. Economic growth. Paid parental leave can stimulate the economy by enabling families to spend less on childcare, health, and necessities, supporting local businesses. Enrollment increases in public schools. Gender equality. Encouraging both parents to take leave promotes shared responsibility at home, helping to close the gender gap in caregiving and career achievement. Long-term child development. Children who have parents available during their formative months often experience better developmental outcomes, leading to more educated and capable folks in our future workforce and in our future community. I'm really excited to vote in favor of this policy. I think that this is a policy that is deeply oriented towards what's in the best interest of folks holistically. And I think there's a lot for us to gain, and I think it helps us distinguish ourselves as a district, and makes a very clear statement of the kind of folks that we are. And so I greatly appreciate all the work that's gone into talking about this policy. And I hope that we are able to have a conversation that is informed by both the benefits of this policy and the costs related to it. That's it for my comments.
Dolly. Michelle?
Oh, thank you. Yeah, I have a couple of questions. One of the things that I do see in the policy, so one, I'm gonna ask just about a specific language, which is item number 8, the effective date. This policy will become effective on July 1st, 2026. Requests for any type of leave described in this policy will not be accepted before the effective date. So I do have a question about, because there were several slides around kind of internal HR capacity. So if this passes, would HR actually be able to be ready to implement on July 1st? Because I heard there's a staffing need, and we're at March 9th. So I guess I'm curious about the effectiveness.
Most of the employees who are going to be taking a leave for, like the upcoming school year, most of the teachers, they've already notified us by the end of the school year. And so we would have most of July to get somebody hired and onboarded, and so that they could help us with this, the administration of this, because it would be when school returns in August that there would be the most intense work with the communications with supervisors and taking this leave time.
Okay, so you basically know of the employees who are planning to take some version of parental leave anyway for the subsequent school year.
Not all of them.
Not all, but
yes,
a good enough number that you would at least know who to start working with immediately.
Mhm.
Okay, thank you. Then thank you for all of the, details related to what would be needed to implement and execute this policy well, with a lot of employee engagement, communication, kind of tracking of hours and all of that good stuff. So right now you're saying that you would need 3 FTE. And I'm wondering if you can describe that or explain that a little bit more. And let me just say this, I do believe that you would need more FTE to do this well, and not to leave employees hanging on communication about their leave and their hours and all of their intentions and plans. I'm just not understanding 3 instead of 2, or a 1.8 instead of 3, or a whatever. So if you could just explain that a little bit more.
Sure. Do you want me to, or you can?
I can follow you.
Then you can follow. Okay. Like one of the things that we thought about with this is like, there's an additional administrative tasks, because this time off is based on like the point in time when someone goes on a leave of absence. And most of our other leaves align. The leaves don't, but like the pay codes, the accrual tables that have to be set up and monitored, those are all done. Those are all defaults for folks. This is very like specific to someone taking this leave. And so there is additional auditing, there's additional monitoring of that. I mean,
Jennifer, you're saying like, because it's more personalized and almost customized to the
yes,
individual,
yeah, it isn't as global as
requires,
some
okay,
of the other thing. Everybody in the district except for, MSDR and LTEs gets personal illness. That, those are already built into all of our defaults, but parental leave is not going to be built as a default for our leaves. And because it is based on when the person has the child, that's when the clock starts ticking. And it's a year, you have a year to use the time, rather than our other accruals are on a rolling basis. At the start of the school year, we give everybody a new bucket, you know, things like that. There's just some different timelines with this. We don't know how many additional subs that we're going to need. But it's definitely, we're thinking that it's a possibility that there will be additional subs for these longer times that people are off. So it's not just the frontline is the sub placement position that or software that we use, but there'll be recruiting of those folks. There'll be, you know, we want to interview those. We want to make sure that they're matched up to the schools that these are going into. If it's, you know, if somebody's going to take the parental leave and then they're going to take some extended leave, there are other things in the handbook that kick in, like extended long-term subs, because it's more than a semester. So there just are a lot of potential pieces that we're anticipating will be an additional workload.
One thing I would add, when someone is out on leave, normally there is a payroll processor somewhere in their building, right? The school secretary usually is the payroll processor. So for the leaves that are now going to be longer, that means that in HR, we are going to have to be entering all of those leaves for, again, a 50% leave. So that's just more payroll related work, that entering that time that happens with every single pay. I think a lot of, certainly auditing that has to happen every single payroll. There's also the setup that Jennifer mentioned, but then there's that day-to-day entering of all of that paid time. That will definitely be an increase, in addition to, again, the communication back and forth, making sure the leave statements, which now have a new category of leave, are updated and maintained appropriately. And then again, coordinating with FMLA. This policy, as I recall from the drafting, is we were trying to tie it or align it with FMLA, but there are also differences. So we have to make sure that we're tracking separately. For example, FMLA is 12 weeks, but this policy is 60 work days. So they're slightly different. They don't perfectly align. So it's managing those timelines as well. That would be a little bit more of a challenge for us to make sure we're giving everybody their appropriate leave types.
Okay. So I hear that there's some back end work that would have to be done to get all of this set up. Do you imagine, or can you imagine that after the initial setup and maybe a year of implementing, you then might not need the 3 positions? I know it's hard to predict the future. But what I hear is there's some, because it's a newer type of leave and there aren't systems already set up, there is some initial work that has to be done to get the system set up and then to kind of work through it. But yeah, I guess what I'm wondering is like, is that a one-time kind of expense? And then after it's set up and you all have learned some things and some employees have taken the benefit and you gain some insights on efficiencies in tracking or whatever, maybe you might not need 3 FTE.
I think it's both of those things.
Okay.
We'll need additional assistance to get this set up and running and see these things. But I think that we would definitely look to see where we could have efficiencies, where we could use our, the software that we have in place to do this. But, our initial thought about this, was that additional FTE would be needed for, at least 12 months or probably 8 to 24 months to get this to get this going, to find those efficiencies, to make sure that we're doing this the right way.
Okay. That helps me better understand the 3.0 FTE. you've already kind of described this. There may be some projections, but you don't know exactly if that would work. I mean, what the realities will be. I'm sorry, I should have described it like that. I think, we're in an interesting position. Because sometimes when you're thinking about benefits for our employees, what I've experienced is that oftentimes those ideas come from the administration on new ways that we want to retain employees or deepen their engagement, or kind of here's a new recruitment, retention, satisfaction approach that we would like to implement. And in this case, it's coming from board members. And I do think, there is beauty in that, and that the board, if voting for this, is saying like, we see this as a benefit, and we think this is can be a value add for our employees. It may cause some initial stress for, I guess, our HR department to get things set up. But sometimes those things are necessary to get the added benefit. So I appreciate that Board Member Muldrow articulated, kind of the benefits of this leave. And I know that, so I'm in support of the policy as well. I also want to recognize, I'm a firm believer that in order for you all to implement and execute it, you need to have whatever you've identified in order to do it well. So I don't know if it's 3-point FTE, but I feel like you all have described more of what you think you would need. And I appreciate that as well. I think my last overall comment is, because we've been in a budget conversation tonight, and we will continue to be in budget conversations over the next, few months. I think that we have a number of things that we're looking at about what we see as benefits for our employees. Health insurance, good dental insurance, right? Access to progressive and good parental leave. So all of those things, I think, do make us a strong district in terms of attracting folks and retaining folks. And we also know there's a cost for each of that. So I just think that as we move forward, if the board ends up saying yes to this, we just also have to weigh that with what else are we saying yes to, and what can we afford to come out with a balanced budget. And I'm willing to lean into those conversations.
Thank you. Fabian?
Thanks. My just brief comments are I'm looking forward to voting, supporting this policy. As a young new parent, definitely understand the relevance and importance to it, but just on general principles, a right of labor and investing in our teachers and all school staff. I think this is something important for us to do, and kind of unique among school districts in Wisconsin that we would be offering this, to my understanding. To board member Nichols' point, obviously there will need to be follow-up conversations and meetings on how we augment the policy so it's as efficient as possible, but got to take the first step. So thank you.
Thank you, Fabian. Martha?
Thank you. I appreciate all of the conversation about this. Thank you, Blair. Board member Wilson for bringing this forward and continue to work on it. I really like all the points remember Muldrow that you brought up on all the positive things that go along with this, while also being cognizant of the cost that's behind it as well. As a parent, when I had my daughter, was only had 5 weeks available, and she was in the NICU for 81 days. It was really, really challenging to do that and feel like balancing life appropriately. Trying to be everywhere all at once. I think taking that extra time at the very beginning of life changes that are really hard is really important. And considering if we start with kids when they're really young, have a lot of parents as part of our workforce. I think this is a really important thing to have that supports them, all those things. Also looking very much in support of this policy. Thank you everybody for working on it.
Thank you, Martha. Okay, I will say a few comments and then open it up for the last kind of other comments that folks may want to make. I think I really appreciate us leaning into ensuring that all employees are eligible for this. Just from your comments, even from tonight, just about, you know, who has access to FMLA and who doesn't. I think if I think about our hourly folks and folks who may not qualify for that, this allows them to take care of themselves and their families in very profound ways. So, you know, kudos to the board for really leaning in on all employees having access to this. The other thing is that my hope is that with the advocacy that is happening at the state level around just universal parental leave statewide in Wisconsin, although if we pass this, we will be one of very few districts and really entities, like governmental entities, that would have something like this. You know, my hope is if it does go statewide and we're pushing statewide, that it allows us to also have further support budgetarily as well. And so I'm grateful for us really making sure this comes through and really pushing it. And I look forward to hopefully voting on this soon. So go ahead.
Okay, well, speaking of which, because the language in this policy will impact the handbook language, which is where the descriptions of our leaves live. It's my understanding that the next move from here is to forward this policy to the Joint Review Handbook Committee for review and consideration. So I'll make that motion, and then if I have a second and people have questions, we can discuss. So I move that pursuant to section 18 of the employee handbook, the board forward the proposed parental leave policy to the review committee for review.
Second, Nikki Vandermeulen.
But okay, we got a second from Nikki. Discussion. Go ahead.
Yes, I just have one question on process. So if we vote tonight to send it to the joint review of the handbook committee, they will have a discussion. Usually handbook items have come back to the board anyway. So are we assuming that this policy as it's written will come back to us as a handbook recommendation along with other recommendations that they may have consensus on for 26, 27, and then we're voting on it as an entire body of handbook recommendations? That's, I guess, my clarifying question. Or are we sending it there for discussion and then we're still treating the parental leave policy over here as a separate vote independent of the handbook recommendations? So that was the only thing I wanted to get clear on. Any rationale that has thought that through is I can accept, but I just wanted to get clear on the vote that we're taking later.
Yes.
Yeah.
Yep. Ben, I see you came on.
Oh.
Do you want to, are you there? Do you want me to answer this or do you want to answer this? What do you think?
I guess, yeah, I'll defer if I can chime in if you want me to, but yeah.
Sure. If I say the wrong thing. So my understanding, Madam President, is when this goes to the Joint Review Committee, as with all sort of like topics on the table, if there is consensus, it would come back wholesale for us to approve in one vote. If there's not, then it would come back forwarded directly from the superintendent for us to vote on as policy. So I can't speak to what will happen in the joint review committee.
Okay.
I think this is a really exciting proposal that is really good for the people who work for MMSD and really good for our whole city. So my hope is that there's consensus over it. We're on it. That would come back in April. But if not, it would come back as a policy.
Got it.
Kind of bounce back to us.
And Ben, you wanna add something?
Sure, yeah, so, and to your specific question, Board President Nichols. So, if it goes to the handbook, the review committee, the usual process would be that, like Blair said, we would try to reach consensus during the review committee stage to bring that to the board as a joint effort. If there is not consensus, then it would come as a recommendation from the superintendent. I don't think that it would go back through the policy process at that point. It would be presented to the board as a recommendation for the handbook from the superintendent. So from my perspective, we kind of need to choose one or the other. So if we're doing the handbook route, then we can do that. It's just that if we don't reach consensus, then it would come from the superintendent as a recommendation for the handbook.
So from my perspective, that sounds totally fine. We've worked closely with legal, we've worked closely with HR to develop the language here. And so whether or not we vote on it as a policy or as the handbook language, to me, is neither here nor there.
Yes, I appreciate that, and I don't wanna add this, I just wanna make sure I'm clear, because what we have heard in the past on the board is that when the handbook committee is in months of meeting, right? Our labor friends are coming forward with their set of things that they would like to see in the handbook process, and the administration as well. And there's oftentimes quite a bit of negotiation and discussion about what's prioritized, where do they have consensus? So, and that those are when they're bringing things. So now we're saying we have a policy. We want you to consider this, but it didn't necessarily come from the administration. It didn't necessarily come from them. So what I'm worried about is that if it goes to the handbook process, will it be even a priority to be on the table for discussion in order for a 26-27? Do you know what I'm saying? Like that's the thing that I'm not as clear on.
Yeah, go ahead.
If it goes through that process.
So two things. One, I do believe that there has already been conversation with our union partners surrounding this process. That's accurate.
It's accurate.
And I also myself have lived it, that this was already coming through. Part of the work is already done with this piece, so
Yes.
it will just be that conversation that you're talking about. Now, and that's it. So while you're saying that, a lot of the pre-work has already been done to kind of like tease this up for them to understand like this is potentially coming back down that way for us to engage with them in the conversation.
Okay. And from your understanding, Dr. McCray, this won't take away from the other items that people are bringing forward into the handbook process, or meaning, I don't mean it like that way about the policy. I just mean that I know that sometimes there's a lot of carryover ideas and topics that were put on hold from the previous year, and people are eager to get back to those discussions. And so, yeah, just wondering.
So I think that we've already met. We've already identified where our priorities are as a group. So we've met with just, for example, NTI, and then Scott has met with all of the trades and all those individuals. And so we're kind of already in that process where the priorities have already been identified. And what we begin doing is having sub meetings to those where we're working on those individuals' priorities. And then we're meeting that first week when we're back from spring break as a whole group to then kind of begin having those discussions. Now, one of the things we did identify and we talked about, which is going to be a little bit different from this one, which is why we got to have the conversation, is we agreed not for this year to have any handbook changes that were that have budget implications.
For the 26-27 school year.
Correct. But this one does, but I think again, there's kind of been some conversations with our union partners already. I'm not exactly sure what all those conversations have been. So in April, this will be one that we will just have a conversation with them about where we are and what we.
Okay.
Can I add one other thing?
Do you mind if I add one more piece? But I also think that's one of the reasons why board member Moses Feltman has been open to say, I want this to go to the handbook. But in the event it doesn't, then it can come back as a policy for us to be able to vote. But let's take it through the handbook because one, that's more of a collaborative approach. Two, that's where all of our leaves are. So let's just say we get to the point and for whatever reason, there's not that consensus because, well, we already agreed or we want to table this one with the other ones for next year. The opportunity is there for it then to become a straight policy versus it being in the hand.
Okay, thank you.
Or did you still want to add something? Okay. Martha?
Thank you. Oh. During when bringing it to the handbook committee, are you planning on, like, is there gonna be a board member that's also gonna be there or any question? Or was that your intention at all to be available?
I was not planning to be a part of it. I'm going with the portion of the employee handbook that says the board can unilaterally forward something to the review committee for discussion. And so I was gonna trust the team on the review committee to say, we're forwarding this for your consideration. I feel sure that members of the handbook committee are watching this now and are following closely the indications that we've given as a group, that this is something that we want to do and care about. And so I want to trust that process.
Okay, I was just, didn't know how close, or like President Nichols was talking about the discussion that's happening in the moment, if it might be helpful at all to have some sort of direct access to you who's been working on it for a while. So that's what I was.
Thank you, Martha. Ollie?
Thank you. I'm gonna vote in favor of us sending this to the handbook committee, but I want to be clear that I don't believe this policy should live in the handbook. I believe that this policy should be board policy. And I believe that it has handbook implications, and I think that we should navigate those with the handbook committee. But I would like to vote on this policy at our regular board meeting in April in order to be appropriately prepared for the financial implications of this policy. And I do understand the effort to reach consensus with our workforce and our union, but this policy does impact people who are not part of our union. And I don't want to discount the voices of those people. The other thing I want to say is our administration has brought us policy that has implications in relationship to the handbook before that our union did not agree with. And the board has said, we will align with our administration on changes to the handbook or policies that implicate the handbook because we believe they are in the best interest of the entire community. So as much as I appreciate the collaboration, I think this is a long time coming to be able to do this work, and it reconciles very serious issues in relationship to gender equity that I don't want to have a prolonged conversation about. And I think we can pass the policy and review it over and over again. You know, if folks find that there are unexpected consequences related to it disadvantaging our workforce in some way that I am struggling to imagine. Thank you. So, yeah, with that said, we have a motion by Blair with Nikki seconding it. We've had discussion. And now you need roll call. Do you want to do just?
Roll call.
Okay. Nikki?
Aye,
Oh, did you say you wanted a roll call?
yes,
Okay. Board President Nichols.
Aye.
Sabian. Sorry, Board Member Castro.
Aye.
Board Member Mulder Feltham.
Aye.
Board Member Sarabo.
Aye.
Board Member Muldrow.
Aye.
Board Member Vandermeulen.
aye.
And is Claire on? I forgot her.
I'm here.
Okay, Board Representative Lee.
Aye.
And then Board Vice President Pearson, aye. That motion has passed 7-0. So it will be going to,
Congrats,
what'd you say?
Congrats, ladies.
Okay, yeah, so it will be going to the handbook committee. And depending on how it goes there, we may get it back. You know, as a handbook consideration or as a policy, the hope is that we will be able to vote on something in the coming months. So thank y'all. That is it for the parental leave. Turn it back to Sabian.
All right, that is the conclusion of our meeting. May I get a motion to adjourn?
So moved.
Board member,
Second.
Board member Lee, you're invited.
Aye.
Those in favor?